But I'm not hearing anything. I'm seeing the slide, but I'm not hearing anything.
Yeah, they mentioned we'd start in around 10 to 15 minutes. I think they're still preparing.
Okay, thank you.
We're ready for our next session, please. Our presenter is online and he's waiting. So let's wind up our break and be back to the table. I hope you enjoyed the break or are still enjoying it, but it must come to an end like all the things. All good things must come to an end. So please, can we wind up this break? I welcome you back to the session. Yes. I hope you enjoyed the break. I did not see the hand washing facility. What we preach, but it's okay. Even those who score A class don't score 100%. Assume that we are practicing what we preach. Colleagues, friends, ladies and gentlemen, we are going to our next session and we are going to unpack safely managed drinking water, sanitation and hygiene, basic water, sanitation and hygiene. And this session is going to be facilitated by JMP, our colleagues from JMP, Lars, Rick, did I say it well, are going to be leading us in this session. Lars, how would you like to proceed?
And yes, I just a few words to introduce Rick.
Of course, thank you.
Thank you very much. So nice to see almost everyone back from tea break or still with the tea. Yeah, very happy to be here. And
I've been advised in our midst we have the Chief Administrative Officer, Ginger District, Mr. Yanakamate. Wow. Thank you so much for joining us. You came right in time for us. And before we close, you have a word, and say hello to the people from Kampala.
thank you. So you will go the next, basically until the end of today, we'll try to unpack the estimates, the global estimates, but also in comparison with how they link to the sector statistics in Uganda. And we'll start with a few presentations just to give a first overview of where the how the joint monitoring program is putting together the estimates that you likely have seen before. We try to be not too fast, like we know some of you are almost experts and have heard those presentations before, others may be less. So we'll try to take time to really go into the details so that everyone is on the same page at the end of today. And during lunch, coffee breaks, tea breaks, feel free to approach me. I'm happy to explain it in more detail. But now to start, Rick Johnson joined us from Geneva, from WHO. And Rick, if you want to unmute yourself, and I hope we can hear you well, Rick will give a first introduction to the joint monitoring program.
Hello, everyone. This is Rick in WHO Geneva. Can you hear me all right?
We can hear you well.
Okay. So I didn't get a chance to share my sentiment in the opening session, but I'm feeling grateful. I'm feeling grateful for many things, including being healthy, having good friends and family, but also grateful for the chance to participate even remotely in this important meeting in Uganda. So as Lars said, my name is Rick. I'm based in Geneva, and I co-lead the joint monitoring program along with UNICEF. And my counterpart at UNICEF, Tom Slaymaker, is also participating virtually. You'll get a chance to hear from him later in the workshop. But the JMP has been around for a long time. We were actually founded in 1990, so even before the MDGs. And we were responsible for tracking WASH during the MDGs and now WASH in the SDGs. And with the SDGs, we've seen an expansion of the ambition of sector targets for sanitation and water and hygiene. So whereas in the MDGs, we were tracking pretty basic indicators about water and sanitation in households, now we're actually focusing on water, sanitation, and hygiene in households, but also in schools and healthcare facilities. Just a technical note, I see that the view that's being projected is the notes view and not the full presentation view. So I don't know if it's possible to switch that. Anyway, you can see my notes this way. It's okay. The JMP is now in a regular steady cycle where we update each of these global databases every 2 years. So in odd years, we update the database on WASH in households. Our most recent report came out last year, 2023, with a special focus on gender. And then in the even years, we turn to schools and healthcare facilities. Just last month, we published a report on WASH in schools with a special focus on menstrual health in schools. And in the next 1 or 2 months, we should publish the report on WASH in healthcare facilities. So maybe we could move to the next slide then on introduction. Maybe just go ahead and have it with the notes. There's nothing secret. Yes, that one, that's perfect. So this is, let's see, maybe go back one actually to the localizing SDG targets and indicators. So the SDG targets and indicators were laid out and agreed by all member states back in 2015 through the Transforming Our World document, the 2030 Agenda for Sustainable Development. And this is the document that establishes the SDGs, but it also speaks about global targets and indicators, as well as national targets and indicators. And a lot of people don't realize that the global targets are defined as aspirational. So each government is expected to set its own national targets, guided by the global level of ambition, but taking into account national circumstances. So the SDG framework does not say every country has to reach 100% by 2030. It says that every country should look at the global framework, the global indicators, and set its own national targets. So if 100% is not a practical target for a country, they're encouraged to set appropriate targets to meet their national circumstances. In addition to the global indicators that track the SDGs, there might be additional indicators which would be applicable at the regional level or the national level. So member states are encouraged to set additional or complementary indicators for the different development areas, which are not the same as the SDG targets and indicators. So the whole SDG framework anticipates and encourages countries to really localize the SDG targets and indicators. That doesn't mean to change the definition of the global indicators, but it does mean to adapt the targets, the level of achievement for the global indicators, and also to complement the global indicators with national or regional indicators that cover other aspects that are important locally. On the next slide, we have a overview of the indicators that are covered within SDG 6. So SDG 6 has, this is the water and sanitation target, of course, and it has 12 technical indicators with it. And each indicator has a global custodian agency, which is mandated to collect data, make sure it's comparable, and publish reports. So there are the 10 technical indicators, 6.1 through 6.6, that are complemented by 2 means of implementation indicators, 6.A and 6.B. But today we're really going to focus on 6.1 and 6.2, which are about safely managed drinking water and sanitation and hygiene. Though, as Martha noted, there are also links with 6.3. We could talk about wastewater, and 6.4 about water use efficiency. So I think it is important to consider SDG 6 as having interlinkages between the different targets. And then if you just click one more time, the means of implementation, 6A and 6B, these are monitored by the GLAAS process. And I know that Uganda has been a strong champion of GLAAS works. And tomorrow, DDA will be talking about the GLAAS process, which collects information on many indicators, including the SDG target 6.A, which is about development assistance, and 6.B, which is about participation of local communities in water and sanitation management. Okay, if we move to the next slide, this is just a summary from the last household report that came out in 2023, which is maybe a bit of a good news story. It's about the population that has access to different service levels for WASH and how that's changed between 2000 and 2022. And really, we've seen a tremendous increase both in the global population, going from 6.1 to 8 billion. So we added nearly 2 billion people over those 22 years. But both the proportion and the number of people with WASH services has increased substantially. So since 2000, 2.1 billion people have gained access to safely managed drinking water. 2.5 billion have gained access to safely managed sanitation. Now, hygiene, we haven't been monitoring as long, just since 2015, but even since then, 1 billion people have gained access to basic hygiene services. So there is a good news story here. The absolute number and the percent of coverage is increasing throughout the world. However, because of population growth, the population lacking basic services that you see there in yellow and orange is only reducing slowly. So we're more or less keeping up at a global level with population growth, but it does make it a challenge to extend WASH services to the most vulnerable populations. On the next slide, we discuss a few very basic principles for SDG monitoring. Obviously, these are global indicators, so the definitions need to be consistent. And these have been agreed by all member states. There's an interagency and expert group on SDGs, which is led by national statistical offices that sets the definitions for all of the indicators. And as I mentioned earlier, there's a recommendation that countries can add complementary national indicators to supplement those global indicators, but that they shouldn't redefine the global indicators. And this is important because we need to be consistent. We need to make sure that when we talk about safely managed drinking water in one country, it means the same thing as safely managed drinking water in a different country. So that implies using some common rules, some common methods for all countries, whether they're rich or poor in different parts of the world. And also because we're interested in tracking progress, we really try to focus on using data sources from multiple years so that we can come up with statistics not just about what the current level is, but what the rates of progress are, what the direction of travel is. That can help us to identify areas that need acceleration or to see how close countries are to meeting their national targets, as well as the global overall targets. So on the next slide, where do these data come from then? And there's different potential sources for SDG monitoring. The first principle is that all data used for SDG monitoring should be official national data sources. And the guardian of what counts as a national data source is always the National Statistics Office. So in Uganda, really it's UBOS. If UBOS says this is a data source you can use, the global indicator teams will use it. If they say that's not a good data source, then we won't use it. So yeah, official national data sources is the first condition. Second, the data sources should be aligned to a reasonable extent with the globally agreed SDG indicators and definitions. Now, often we find that there are some slight differences. So there's some work there to see, well, does this national data set match the global indicator closely enough that it can be used for SDG reporting? The third important principle is that the data sources should be representative. That could be of national populations, or it could be of urban or rural populations. We often find that there are some data sets that are very good, but they're restricted to some parts of the country. Maybe because they were done with a project or a program that doesn't cover the entire country. So that might not be suitable to use for SDG monitoring. Also, the indicators 6.1 and 6.2 are formulated about the proportion of the population that uses different types of WASH services. So it's important that the data be expressed in units of populations for SDG monitoring, at least for these two targets. Other ones are different. Target 6.3 on wastewater is about volumes of wastewater safely treated. So obviously that one is it's not about populations. So taking those criteria into account, the potential data sources can be very broad. They can include household surveys and censuses, but they can also include administrative data. And those each have their own advantages and disadvantages. So if we look on the next slide at a comparison of administrative data versus survey data, well, what is administrative data? Administrative data can be collected at different levels for different types of units. It can be collected to represent households or schools, healthcare facilities. Often administrative data are at the level of some infrastructure, water supply schemes, wastewater treatment plants, or fecal sludge treatment plants. Whereas survey data are normally collected at the population level, and they tend to be representative of rural or urban or national populations. So those both have pros and cons. One big advantage of the administrative data is that it can be disaggregated by the administrative units where decisions are made. It can be very granular. It can extend down to very local levels. And we find that this type of administrative data tends to be most reliable for service level type indicators. If you think about drinking water quality or wastewater treatment, that type of information is about service delivery, and the information should come from the service deliverers themselves or the organizations that oversee them. Households don't know what happens to wastewater once it's flushed down a toilet and leaves their houses. On the other hand, one of the big advantages of survey data is around indicators that are about the use of different facilities. households know very well what type of water supplies and toilets they are using. So we give preference to population-based survey data for use of type indicators, but then we give preference to administrative data for quality service level type indicators. Now, survey data can be great for knowing how many people are using what type of facilities, but they have some serious limitations. They're infrequently updated. Households have limited knowledge, and they may be technically incorrect about some things. And also, they don't tend to be powered to give information at the very local level. They're really designed to give national or maybe admin 1 level subnational data, but they're not likely to give very localized district scale information. So what the JMP does then is it takes both kinds of data together to get a full picture of the WASH services. Now, on the next slide, I mentioned already that the JMP updates those global reports every 2 years, and now we have this standard cycle where we're continuously identifying national data sources. We're looking on the websites of statistical offices and sector organizations. We rely substantially on the UNICEF and WHO offices at the country level and the regional level. So for instance, we have from the Ministry of Water and Environment in Uganda, the sector performance report from 2019 that was identified. Then that's going on continuously. Starting in the summer, say in August through October, the JMP team prepares draft estimates. We pull together all of the national data sources we could find. We put them in a simple linear regression. I'll speak more about that later. And then we prepare draft estimates that we share with the countries, usually in November, for about a 2-month period of consultation. So the country can see what data sources we've identified, what estimates we've developed using those national data sources. And then they give us their feedback by the end of January. That gives us a couple of months to finalize the estimates and then write and publish a report, which usually comes out around June or so in the summer. So that's our annual cycle, and we do it every 2 years for households, and then in the other years for schools and healthcare facilities. On the next slide, I mentioned that the middle phase there is the country consultation, and this is a really critical phase because, I mean, these SDG indicators are representing the countries, your countries. So we need to make sure that they are as complete and correct as possible. So to do that, the JMP produces a guidance note. It prepares the draft estimates to be shared with the countries, and those are delivered through the WHO and UNICEF country offices. The authorities differ from country to country who needs to be involved in the review, but it's always the National Statistics Office. It's usually, in our case, the Ministry of Water, but there might be other ministries that are responsible for sanitation or hygiene, and certainly for schools and healthcare facilities, there are other ministries. In some countries, there are regulators. So there should be a broad sectoral review of the draft estimates. And when making this review, we really ask countries 3 questions. We ask, are we missing any relevant national data sources? We ask, are the data sources we found and used, should they be considered reliable? Sometimes we find a data source that especially the NSO doesn't consider should be used for national statistics, and then we don't use it. Sorry, back up, please. And then third is the interpretation and classification of national data correct? And especially where the terms and indicators used in the national data source don't match perfectly the SDG indicators, there can be some interpretation opportunities and scope for errors. So we ask countries to then take a couple months, look at this, and provide us feedback by the end of January so that we can publish the progress update in the coming quarter. Okay, as I mentioned, the last household report had a special focus on gender, and I just wanted to show one figure from that report. not about the gender aspects, but about the data aspects. On the next slide, you can see that we've now had 4 SDG reports since the start of the SDGs, and this is about the number of data sources used in each report. You can see that it's been growing steadily, that we have almost 4,000 data sources in the global database for drinking water, as well as for sanitation. We've got over 5,000 for some kind of wash. We have a much smaller number, just what is it, 260 or so about hygiene. And then only in the last couple of reports, we've started publishing data on menstrual health. So the number of data sources we have for menstrual health is quite small, but is growing rapidly. And the different colors on the bars tells you what kind of data source they are. So the darker colors, the very darkest, are censuses. And the second darkest color is household surveys. About half of the data sources come from household surveys and censuses, and the other half tend to be from administrative data. Though for hygiene and menstrual health, those are coming exclusively from household surveys because those types of indicators are typically not collected through administrative data sources. The last slide I want to mention is that all of these data and the country files that include both the data sources and the estimates are available on the JMP's website, washdata.org. We'll be showing you how you can access some of those materials in the coming sessions and days. And with that, I'm going to turn over the microphone to Lars to present the WASH service ladders for drinking water, and then I'll come back to talk about sanitation and hygiene. So thanks very much.
Thanks, Rick. Good, so I'll continue. I hope the online team can also hear me well. Otherwise, Christopher give me a thumbs up. I hope everyone can hear me well. If you can just check and let me know if there's any problem there. So today, we talk about wash in households. And there will be on Thursday morning, we'll have a session on wash in schools and wash in healthcare facilities. So that's coming, but just for the context today, we're focusing on water, sanitation, and hygiene at the household level. To introduce the service levels, I'm sure you have heard about the service levels. Yeah, the ladder going up from the very basics. So when we talk about water, yeah, the lowest service level is just the use of surface water. Moving up, we come to unimproved drinking water sources. Yeah, if a household reports or is using an unprotected well or an unprotected spring. And then, and some of you remember the MDGs, we just talked about improved water sources, which now, as we moved into the SDGs, is a bit more refined. So up here, limited, basic, and safely managed service level are all for improved water sources, but with more information around it. And so we have the technology classification, basically, all improved ones up here. If it's improved, but more than 30 minutes round trip to collect the water, it's about time, about accessibility. If it's more than 30 minutes round trip, including queuing, we would just say it's a limited service. If it's within 30 minutes, it's at least basic. And if more criteria are met, yeah, if water is accessible on premises, if it's available when needed, and if it is of good quality, yeah, if it's free from fecal and parotid chemical contamination, we would call it safely managed. So basics, drinking water services and safely managed may be called at least basic. Yeah, that's the 5 levels identified. Here you see the results from the latest report for Uganda, and we'll go a bit more into details on how they are established, but that's the basic definitions. And there is exactly the same logic with different service levels for sanitation. Again, the lowest service level, yeah, for water it's surface water, no service. For sanitation it's open-ification, no service, no technology, nothing available. The second is unimproved, which means households are using unimproved type of latrines. Again, improved, unimproved refers to a technology classification. Certain technologies being recognized as being improved, others classified as unimproved. And then if households are using improved sanitation facilities, it's again split into 3 levels. Those are the households, basic means improved but not generic, and then the safely managed goes a bit further. It's not only about what is the household using, but what is happening afterwards with the fecal waste. Yeah, so if it's either disposed safely in situ, if it's emptied and treated, or if it's like removed or generally removed and treated offsite, either emptied and then sludge treated, or through a sewer system to a wastewater treatment plant, then it will be recognized as safely managed. And then the last service ladder we have is for hygiene, all around hand washing. The lowest level, there is no hand washing facility available in the household at all. There will be no facility limited to this. There is hand washing facility, but there is either water or soap missing. Yeah, there is a place where people could wash their hands, but there is no soap or water available. And the highest level or the basic level is hand washing, soap and water available. Basically, if anyone wants to wash their hands, it's readily there available with water and soap and a hand washing facility. So that's the definitions there for the service levels. What I'd like to do now is to introduce the country file. Rick already mentioned the washdata.org website. When you go there on the data for each country, there is a country file available. You can go here on the data, you'll find Uganda, and then for the households, you can download the country file, which looks like that. And in this document, you'll find all the information, all the data sources that have been used by the job monitoring program to establish a national estimate. And Rick already mentioned it. It's not that the job monitoring program just makes some estimates. It's all data sources that are recognized by the country. In case of Uganda, data sources recognized by UBOS. This file just summarizes the data and then uses a consistent methodology across countries to come up with the country estimate. And if you're interested in that document, you'll find everything, and we'll also do a short exercise on that today to really make sure all of you have at least once downloaded the document and find your way around it. Now we are in this document, and here you can see it's just an Excel spreadsheet. When you go to the ladders, you see here the nice numbers that we showed before, the data summary. But there is more. There you have the data summary with all different data points. So what you can find here, and it's too small, and we'll look at the data, the spreadsheet afterwards. It's okay if you can't read it. But here basically you'll find all the different documents, surveys, administrative data, all the documents that were used. It's, if I'm not mistaken, 56 since the year 2000 for Uganda. And for up here, you have drinking water, you have sanitation. If you go further in the document to this side, you'll find hygiene and menstrual hygiene as well. And for certain aspects, there are very few data sources, while for other aspects, we already have a lot of information. And I assume also part of this workshop is to find out how we could close some of those data gaps, information gaps, where we just don't know that much yet. Where could this information be coming from in the future? So when you look here at these numbers, I just want to highlight, or let me go to actually to the next one. Now, if we just look at drinking water and maybe, oh, sorry. Let me go here. For drinking water, just to highlight the admin. Yeah, there's some administrative data that has been used, and you can see here that's all the sector performance reports from 2012 to 2019. Yeah, those are integrated. They're used. Some of those 42 indicators and results are valued or captured and added to the document. Also, if you now go to rural, yeah, that's just rural drinking water, improved water source. You can see there's a range of data sources with information. A few have brackets around it. When they're in a bracket, that means the job monitoring program is aware that, and the sector is aware that those data exist, but decided not to use them. Yeah, that could be, maybe you both said, yeah, we recognize that's information that's there, but we don't recommend using that to the country estimate. Yeah? If they're in brackets, it means they're not being used for the estimate. But they're still there, and it's good to recognize whatever data sources are available. Now, just to give an example, we had the DHS 2016 in Uganda, and there the estimate was 75% of rural households are using an improved drinking water source. So this data point here moves then into a graph. 2015, 75%, but then let's plot all of them. So that's now all the data points over the past years, and then the joint monitoring program or the estimates would put in a linear regression. Using those data points, there's a positive trend. And we see the individual surveys, some have show a bit higher access to improved water sources, some a bit lower, but generally over the past 20 years, there's a positive trend with more and more people getting access to improved drinking water. And now this regression curve is used. So if we check for 2022, for the latest estimate goes up to this regression curve, back to check on the service, the current level of access, so that's 81%. That's how it works. It's through the linear regression, so all the data points are used, and we can establish the estimate. So back to our service ladder, improved means it includes safely managed, it includes basic and limited services, everything but unimproved and service. And that's this 81% were generated that way, and that we get this number. The same is then done for the basic estimate again, the curve here, going back for the year 2022, and that's in everything, at least basic, including safely managed and basic water services. Good. So that was just a summary. I don't do that now for each and every indicator. That would become really boring. But just to show that's the principal logic applied for all the different indicators. Yeah, we get a range of different data sources, put that together, plot it, do a linear regression, and then for the respective year of interest, getting the value, the best estimate for that year. If there's not enough data available, it gets a bit more complicated, and we may go a bit into details later on, especially on Thursday morning. I think there, like it wouldn't just go on if there's no data source at one point, the curve would just be flattened, and we would not assume that access would increase without any confirmation through data. Good. And that's then done, yeah, for water, sanitation, hygiene, oblification, and so on. And all those charts again are available in the data in the country file. So that's the service levels. Just a quick introduction about how the service levels are structured and how we would get the estimates. Now we'll do a short deep dive into safely managed drinking water. And then I'll hand you over back to Rick to talk about safely managed sanitation. So this we've already seen, that's the service ladder for drinking water. And as mentioned before, safely managed has now a few more criteria. It's not enough to just see this household is using an improved water source as under the SDGs. It needs to be accessible on premises. It needs to be available when needed. And it needs to be free from contamination. If those three criteria are fulfilled, then we would actually consider it to be safely managed. This table you also find in the country file. I get back to that later on, where you can see the numbers here, the 81% for rural that we have seen before for improved water sources, and then the different values for Uganda. Estimate for 2022, accessible on premises at 9%, available when needed 70%, and 56% free from contamination. And now I'll briefly walk you through on where those numbers are coming from. So, accessible on premises. That means, for the joint monitoring program, it's piped on premises or zero collection time. It doesn't need to be piped. It can be piped or non-piped, but it needs to be accessible on premises. The data used for Uganda are from UBOS, that's the National Panel Surveys, and from Census, and from DHS, where we have DHS, Malaria Indicator Survey, and AIDS Indicator Survey. So that's currently all based on survey data. That's not data from the sector performance report, it's data from UBOS and from national surveys. Here you see the numbers, again, all the different numbers plotted. So we'd see in urban areas, access on premise really went up over the past 20 years, while there's not that much progress in rural areas. And now I'll come with a short side note. Actually, I need to get my laptop to get some of the notes, because there's a few numbers I'd like to add. What you can see here is the collection time, which is kind of linked to the accessibility. Yeah. So even if it's not safely managed, people have to go and collect. It's the question, who is doing that in a household? So what you can see is different surveys. Uganda is not here, and that's what I'm talking about. That would be nice to also have an estimate for Uganda. We have here minutes spent per day for fetching water, and on this side we have the man, the males, how much they are doing, and the women. And we can see in many countries the women have a much higher burden on collecting water. It would be nice to see where Uganda stands on that graph. So there are some information available, but not all that we need. So from a NHS, from a National Health Survey, we know that about 45% of the households collect water, and the majority are indeed women and children. We also know that the time per trip is on average about 43 minutes, but we don't know how many trips are being done, and therefore we can't really calculate what the actual burden per day is for the different categories, yeah, for men, women, and children, or boys and girls. So just as a point, if there is any survey upcoming where such a question could be asked, would be very valuable, so that we get Uganda on the table and also good estimate. I think there's different ministries here would be very interested in having those numbers available. So just a short side note to promote including that question in an upcoming survey. Moving on from accessibility to availability. And the availability question is probably the one that takes the most interpretation. Like there's different questions. We also have like indicator 5, I think it is in Uganda, that talks about functionality and availability of water. Right now, what is used in the Uganda context, it's the PMA data, where it's about households reporting that they always have water available or it's predictable. Now, from our metadata, it says they were never or only once or twice without water. So that was then kind of seen that roughly corresponds to water is available when needed. There is more household surveys, but currently the data are not used. And yeah, I mentioned that before. There's the sector performance review reports. They have information about data availability, but they have not been used, except for one. And I'm not sure whether that's a mistake or really needs to be there. I think something for you, Rick, to check. One of the sector performance reports estimate was used in the past. Anyway, for availability is pretty good in urban areas, yeah, around 80%. A less clear picture for rural areas, but anyway, there's again a linear regression done to come up with an estimate. And the last one that we had, accessibility and availability, the last one is quality. For quality, we look at absence of fecal contamination, if possible E. coli or other thermotolerant coliforms, and where relevant in countries where it is relevant, also arsenic and fluoride. For Uganda, we have data in the sector performance reviews. They have been used to come up with the quality estimate. However, we also had the Uganda DHS in 2022. And here, first for the admin data, just to show here at the very end for rural, here we have fecal contamination. Here we have, just as example, the sector performance report 2019. Yeah, with those estimates for 18-19, it was 59%. And those values, yeah, find their way into this country file to come up with the estimate of what is the water quality in rural Uganda. Yeah, just to explain again how they are linked and how also administrative data can be used. So here for free of contamination, the data of the sector performance review show that in urban areas the situation is pretty good. Water is usually safe for consumption, while in rural areas it's only about half the time safe. It has a bit of a positive trend though. But, and I would now say there was also Uganda DHS, so the job monitoring program has started doing water quality testing in household surveys. There was an easy kit. UBOS teams would be trained to do a water quality test. So when the teams are going around for a DHS, for instance, in that case, they would not only ask tons of questions, but they would also ask for a glass of drinking water and asking where the water was collected from, and then doing the water quality test for E. coli. They would check for E. coli, presence of E. coli in the glass of drinking water and at the source. So that was done in the DHS for Uganda. I haven't seen the final data yet. Yeah, there's a bit of information available online, but no, maybe some of you have those data. It'd be really nice to see them and to compare how they link to the administrative data. Do we find the same level, that about 60% without E. coli in rural areas, or does it show a very different picture? So how do we calculate then safely managed drinking water at the end? And we came up with the 90% accessible on premises, 70% available when needed, and free from contamination at 56% for rural. So what is done by the joint monitoring program is just taking the lowest of the three, because they come from different data sources. It's not really possible to check what one individual household has, because we have the water quality from the admin data, availability from this household survey, and accessibility from even another one. So for consistency, what the joint monitoring program does is just put the three values together and then at rural and at urban level, taking the minimum value. And you see that then completes our service ladder for rural drinking water, yeah, which is at 9, safely managed. Currently, it's the accessibility on premises that limits the estimate for safely managed drinking water in Uganda. And that was it about how to come up and where the data are coming from and roughly how they're used and put together to put in these service ladders and then shared back as a country estimate. I think from here, I hand over back to Rick, and he will walk us through the same topic, but now about sanitation, safely managed sanitation. Over to you, Rick.
Thanks, Lars. And I believe we have until 1 o'clock for this session, right? So we're going to cover sanitation and hygiene next, and we've got about an hour to do that. We do want to have plenty of time for discussion, but I know that there's been a lot of information presented. Lars just went into a lot of detail about safely managed drinking water. We also had the general overview of JMP processes with linear regressions and global and national indicators. So I wanted to just take the temperature a little bit and see if people would like to already have a brief discussion on drinking water and general processes, or if you would prefer to get all the presentations out of the way and then have a clear block for discussions. We can do it either way. Maybe if people in the room could let me know what their preference is.
Q&A? Your preference for Q&A right away.
Okay, well, maybe I suggest we open for Q&A, but we also make sure that we don't let this take up the rest of the hour, because I'm sure we could talk for a long time. So maybe we could limit it to, I don't know, 15 minutes of Q&A and make sure that at 10 minutes after the hour, we come back and we tackle sanitation, because there will also be questions on sanitation and hygiene, I'm sure.
Thank you, Rick. That will give us some energy. Okay. Okay. Thank you, Lars and Rick. I'm probably sure my question will also be for sanitation and hygiene. During the introduction, I said I was jovial, but the numbers, I think, have diluted my jovialism. And then also hearing from Lars saying Uganda is not included in this. Uganda is not included in this. In the last slides,
that the data for Uganda is not included. And then also saying, oh, we could probably include this in an upcoming survey.
Yes.
And this could be really for us internally for Uganda. Why aren't we included? Why isn't that data not collected? Because it's very important data. It's not collected. But we have been involved in JMP and GLAAS for several years. Do we intentionally skip that question, or it's not there in any interview tool? You also refer to UBOS. How do we influence the interview tools by UBOS? How does UBOS get the questions that they put in the UDHS survey? Because I think that's where it should go, unless there's another tool where it should go. So internally, how are we positioning ourselves to influence the tools, the government of Uganda tools that can enable us to collect that data so that we are included? Why aren't we included? Thank you.
No answer. Another question. When you're sharing the results or methodology for coming up with the accessibility figures, I didn't quite understand why we are not using the SPR data, the Ministry of Water. I know the ministry has a whole database with all this information. So why are we not picking information to inform that particular indicator from the Ministry of Water? Thank you.
Thank you. I said I'm confident you're going to make things better. There's the question in addition to the question that is not included about the number of times that people have to reach water. I am sure that we can actually add another question that would make leaving no one behind even more realistic, because many a times people will only use the amount of water that they are able to fetch, but not actually the amount of water that they need in a household. Would we, since it's UDHS, or can we go to a level of, because I know there are standard amount of water that someone needs in a day, at least to be for personal hygiene. So could we go to that level of finding out, like if we know the number of people in a household, how much water they actually use in a household as a proxy, because they might really, just as a proxy, how much water they use. I don't have the right question. That should give us, and then maybe we'll triangulate that with the number of times they go to fetch water. That can give us a very clear picture of inclusion, like what as a right and what as a. And then also, I know that until a water point has been decommissioned, it still contributes to the access levels, right? So, in the spirit of leaving no one behind, what can we do about that? And at what point, because I know districts complain a lot, there's a lot of dispute between what's in the water atlas and what the districts feel. Because districts will tell you that, even the water atlas will tell you so many water points are non-functional, but they still contribute to the access figures. What can we do about that to make sure that moving forward, even when we say that ministry, this is not for you, so let's not go defending it. What can we do to make sure that, the decommissioning, I don't know that all the science around that, so that when you're talking access levels, it's not a pleasant figure, but it's an actual figure of access levels, and ensuring that actually everyone can have when needed, or you can predict it, and of quality. And then if actually quality is going to be an indicator for safely managed, do we even have safely managed in Kampala? Where we have inter-switch between sewage and water.
It is a question.
Mine was about how they do the computations, the analysis, but from GLAAS presentation, it seems that you just pick data from UBOS, whatever they give you is what you take. Maybe I need a clarification on that. Do you do any analysis or you just pick the data as given to you as UBOS and then you put it in the Uganda profile? Then another one, when it comes to some of the indicators like hand washing, the no service one, is there a possibility of adding the distance of that hand washing facility within the premises? Because sometimes we go to households and they'll tell you, we have a hand washing facility, but it's not like where the point where it's needed. So can we put like maybe 15 meters, 30 meters? That one we can discuss amongst ourselves here. Thank you.
All right, thank you so much for this presentation. As a rejoinder to what my colleague gave us something regarding how we come up with the figures, she's asking whether you do the computations or you just pick data from UBOS. So I expected us in this discussion to determine the denominator and the numerator so that we're able to come up with some figures that are uniform. Because I feel the discrepancy we have in the data that we report, the figures, could be as a result of failing to define what is in our numerator and what is in our denominator. I submit. Thank you.
Start with the engineer.
Yeah, thank you. Mine is simple. You have shown us how you get the self-humanity water, but maybe it will be good if you show us how you get the basic.
Basic.
Yes. Basic water, yes.
Yeah, thank you. Mine is on my neighbor has said that you've shown us how to get safely managed water, but to me, I'm not yet there on how you get the exact figures on safely managed water related to the map that was indicated on the level of people contamination of over 80-something%. I'm like whether we get the right figures, but we want to add all the accessibility, availability, the 43 needs, and then the contamination. I doubt whether we have anything called safely managed. Yeah, secondly, I want to, this is not for the presenters, but I think we needed almost in this room so that we can get the processes of how this data is approved. Because you are integrating different data sets and coming up with the regression, but we don't know which one is approved, what are the processes, and maybe this related to what Diana mentioned, that maybe if we knew the processes, even ours in the MIS, maybe could also be approved such that it is captured.
Maybe closely related to what others are saying, there is a sector performance review, you use it, and then the DHS. Now, which is your preferred source? And since most of us here contribute to the sector performance review, is there a way we can improve it? Maybe there are seeing some gaps, and maybe that would be a preferred. Maybe we could put our energy, since most of us are on that part, then maybe the DHS, most of the sector experts are on the SPR.
Okay. And finally, thank you. Yeah, I know most of these demands. Are we able to have maybe a more, I know there are so many sources, but can we have maybe a source that we say, can we go with this source? And maybe in case there's information which is missing, they can maybe pick information from any other source or something. Thank you.
Okay. so much about the preferred source, the source, and the source.
Okay, mine is not on the source, mine is on accessibility on the premises. For a nation like Uganda, how, and we're just looking at Kampala City, how practical is this and how beneficial does this information help us? I know it's a bit of a contradictory statement coming from a government official, but and ignore what our situation currently, then we have these documents and they are fighting with what we're talking about, which is what our presenter, what you talked about and said, we have all these institutions in place, but why aren't we moving? I think the targets, okay, they seem to be in the air, you know, and not answering a bit down cascadedly, because when we look at the objectives, we want to understand how do we merge all these SDGs and bring them to the national level, you know, so that we stop looking at them as high end and they come down to our level. So in this safely managed, don't we have something that we can report on that actually talks about our movement from one level to another as a country, looking at the urban and the rural setting, so that we are not always caught off guard for not performing against the SDGs, because they seem to be OT. Thank you.
Okay, I'll come back to you last. Interesting questions. The source, SOURCE, not the SAUC.
Thank you. Yeah, many questions, and I think many of those we probably work on over the next few days to answer and reflect on. And for many, there's no clear yes or no either. But I'll try to just give a few clarification where there may have been a misunderstanding to make sure we're on the same page. About the data source. So when we look at the summary of the different data sets that was used, we can see that the sector performance review reports, for instance, are included here. Yeah, it's not that they had been ignored. They are in here and data extracted and used for certain estimates. I think what I'd like to do today in the afternoon as the exercise is for everyone to look at those documents and just to make everyone aware that for transparency, yeah, all this information is available. It's not the black box where the information and how the country estimate is made. It's right here. Yeah, in this document, you can see which sources were used or which data sources were included, and then also which ones, if they don't have brackets, were actually used. And then that could also open a discussion within the sector on whether this exact data source is the right one, or should this be challenged and changed. About household questionnaires. I mean, there is a nice set of core questions that was published by the Joint Monitoring Program. And like the DHS or MIX or many household surveys use standardized questions when it comes to drinking water and sanitation and hygiene.
In all countries. Similarly in all countries.
And yes, the same questions used in many, many countries. Now with Safely Managed, which is relatively new, or new emerging questions, it usually takes a couple of years and experimentation and trying a new question in one survey, like how can we ask that? Do we get good data? And then if useful data is generated, and used in a sector, then it's likely that they will also make it into the core questions and then more widely and globally, and including Uganda, being used. I don't think there is any point that was knowingly omitted for Uganda because no one wanted to know how much time women spent for collecting water. It's just, it wasn't asked. I think it's not included in the DHS, unfortunately, but it's kind of to see if we find a new survey and this question can be included. That's just one additional information that could be generated. And then how to influence as a sector. I think the Ministry of Water and Environment, I know for the DHS, like when I was there to do the water quality testing training, there were the colleagues also from the water quality department there to support. And I understand usually in the DHS, yeah, ministries are invited as part of the steering committee or of a task force to support and to provide guidance and even to be present during the main enumerated training. So that's, and you both can say more about that, like all government stakeholders are usually closely involved when a survey is taking place and invited to provide feedback and to understand how questions are asked and which questions are asked. So I think that's always possible to understand and influence, and ideally based as much as possible on standardized core questions. Quickly, for the basic estimate, there was a question, well, how do we get basic? And that's here I kind of took you through all the data points that are used for improved, access to improved water sources. And here we have the linear regression for that, where we can see access to improved water or using improved water sources increased over the past 20 years. And then the same can be done for the basic estimate. Basic, meaning improved water sources within 30 minutes round trip. And from here, and this 51% of households, that in household survey, or from the data points we have here, and here it's mainly household surveys or only household surveys, that showed and reported to use at least basic. And then out of those, the further analysis is done on safely managed to see, is it really accessible, available, and of good quality, going a ladder up. But it's up to the stakeholders here, to the country, to decide what the goal should be. Should it be 100% safely managed or 100% at least basic and 20% safely managed? That's not for the joint monitoring program to tell. It's just to provide guidance and monitoring framework. And maybe that's also a point where I can hand over to Rick to talk a bit about the preferred data sources for different estimates and where to improve, where we can make use of the sector performance reports, or now new the program performance reports, where those data would be very valuable for country estimates.
Sure, thanks, Lars, and thanks for addressing most of the questions already. I think the question about what our preferred source is, we prefer both, actually. We prefer to use data coming from populations, from surveys like the DHS, but also UBOS has many other surveys. We prefer those for indicators about what people are using, because they know best what types of toilets they're using, what types of water supplies they're using, where the water supply is located. We prefer sector data, administrative data, for things about the quality of services, because they know better what's the quality of water that's delivered, what happens to the wastewater, what happens to the fecal sludge, that the households just don't know. And so that's why we do use the SPR for variables that are more about the quality of service. We're definitely using it for the fecal contamination, but it will be interesting to see how that compares to the stats from the Uganda DHS. The map that Lars showed, I think, probably reflects the quality of water in the household. And actually for the SDG, we use the data on the quality of the water where it's collected by the households, because that's where the state responsibility kind of ends. You know, once people pick up the water, we know that there can be contamination inside the household from poor hygiene, where you have to store water. And we always see that the fecal contamination is higher in stored water than in delivered water, or where water is collected. But I think we could additionally use data from SPR about availability of water when needed. Lars mentioned that it was used once, but not for other ones. And I think as long as the data are representative, the question is well aligned. I think the question in the SPR is about functionality of the water source at the time of the last visit. My question would be, does that cover all water sources, or is it only piped water sources? Is it only public sources? In some countries, there are a lot of privately owned facilities that people use, which sometimes are not captured in administrative data systems. But if the SPR data is covering, you know, private as well as public sources, piped as well as non-piped, then I think we should be able to use it for availability. We probably wouldn't use it for accessibility on premises, because actually the SDG indicator is not about having access to a water supply. It's about using the water supply. And you might have theoretical access coming from a database of infrastructure and, you know, how many people are served by a borehole, but that's not the same as actual use, because sometimes more people or less people use a particular source that's in the inventory. So there's some statistical noise there. So we consider that it's more accurate to ask people what sources they use and use that for the accessibility, and to ask people where that is located, if it's on premises, if it takes more than 30 minutes to go there and collect water and come back. So for accessibility, we'll probably still rely on the household surveys, and there are abundant surveys in Uganda. So Uganda is a very data-rich country. I think the last thing I wanted to say was there were a couple questions about additional indicators, like could you collect information about the amount of water that people collect, or the distance to hand washing devices? And my short answer is you could. Those could be very good national indicators. You have to kind of see if there's something that can be easily collected, either administratively or from a household survey, to yield some information that's useful for the sector that would lead to some action. Those indicators aren't part of the SDG framework, so the JMP won't be collecting them and compiling them. But as we said at the very beginning, it's anticipated and recommended that the global SDG indicators be complemented with national indicators that are relevant to the sector. So with that, we took a little bit more than 15 minutes, but I think it was a good discussion. I'd suggest that we move on to sanitation and hygiene, unless people wanted to clarify any last things about water.
Greg,
Yes?
this is sorry, I say just a few words about the SDGs. You have to remember, during the MDGs, the JMP was very much criticized because the JMP was looking at improved infrastructures. And many people said, look, it's not because you're using an improved infrastructure that you have potable water. The water quality is not necessarily there. So because of that, the JMP worked on safely managed, same forest sanitation, same approach. And this is why the JMP moved into the more diverse classifications of the upper classification that was considered improved. So that's very important to remember. Now, it is a national political decision to say, in my country, in our country, we decide that the level of service should be this. It can be still the improved categories. But because the JMP is supposed to report at global level for SDG 6.1 and 6.2, the JMP has to apply the same approach for all countries, whatever they decide politically about the level of service that they are choosing. The JMP is going to report on all 5 levels. So this is important. It's not saying that Uganda is not doing a good job. It's not that at all. You can go back to the data from the JMP and compare and say, for our policy, this is what we produce, what we have for data, and you can compare. But it's very, very important to understand the necessity to align. So when numbers are produced, it's comparable between countries. The question on distance, it's good. It's very interesting. That can be, as Greg was saying, it can be a very interesting additional information. But you can have a water point that is 50 meters away that will give drops. You may have to wait the entire day to get your bucket full. And what we're looking for is availability of the service. And we consider that waiting the entire day to get the bucket full is a service. So those just 2 additional points. Thanks.
We need to go to the next point, but just one question for us and Ricky to think about. Can we add another level between safely managed and basic, primarily because 9% safely managed water is low. Because of water quality, we need to know also availability of premises. I think we had another question, you answered that already. What kind of consultations take place between JMP and GLAAS and governments? I'd also like to just take this moment to recognize Mr. Abidrago Owen from the Ministry of Local Government. Please, you're most welcome. Thank you for joining us. Thank you. Yes, for you to, somebody's hand on mine? Yeah. Okay, we had allocated 15 minutes to this. So let's find a way of managing the time. Yes, ask the question. Alphonse, would you like to ask a question?
Yeah. This is Alphonse.
Yes, please.
Go ahead and ask.
Yeah, thank you. I just posted it in the chat. I'm just wondering because the data they have used are from different sources, and they have used the regression model. If they use a correlation, will they arrive at the same estimates? Because the regression model has some conditions attached to it. One of it is the normally distributed data. Then, of course, the variance. Okay, the distribution. They're looking at national level, must be the same. Did they check those kind of conditions to make them have the model and do some estimates? I would request they try to use correlation and see whether they will arrive at the same estimate. Thank you.
Maybe I can speak quickly to that one. I think the thing about using a correlation statistical analysis is that it, as I understand it, would not give you information about rates of progress, about trends. And to assess progress, to assess how rapidly countries are progressing to national or global targets, we really need to look at the rates of change over time. And for that, I think regression is a better statistical tool than correlation. You're right that linear regression does have some assumptions that underpin it. We have looked at those in the past, and they tend to be well supported if we think about normality of the underlying distribution and variance. But it's true that in specific countries, there might be differences. But it seems that this is the best available approach to us at the time. We did have a task force that looked at alternative methods to linear regression at the start of the SDG period. And we looked at, more sophisticated models or things that kind of curve instead of just imposing a straight line, and came to the conclusion that given data availability and limitations, that the linear model was the most suitable one for now, at least.
So from the calculation you did, do you have the results of the R square values? Because those are very important to make the model very useful.
Yeah, no, those are available. They're not published in the country files, but they can actually be generated in the country files because the points are there on those graphs that Lars showed. So it's possible to take that regression line and see what the equation is, see what the R squared is. There's so many lines that it would make the graphics kind of cluttered, and most people don't want that level of information, but it's possible to do from the country files.
Great. I think the other two questions will come up. One is about consultation, or any way forward. Rick will talk about it just in a few minutes. And I think about a service level between basic and safely managed. I doubt that the joint monitoring program, or do you want to take that?
Actually, Lars, if you can go back one slide, I'll take to that, and then I'll carry on for sanitation, if that's okay. We see that globally, so we take this minimum of the three approaches, accessibility on premises, availability when needed, and freedom from contamination. And in different settings, different ones of those are more limiting. So we often find that in about half of countries, it's the water quality that's the limiting factor. Water is accessible on premises, it's available when needed, but it's contaminated. But in some settings, it's availability when needed. We see this a lot in kind of middle income countries in urban settings where they have piped water, the quality is good, but it's intermittent and it's not always available when they need it. In sub-Saharan Africa, we very often see, especially in rural areas, that it's accessibility on premises that is the bigger constraint. So some programming can be oriented accordingly around that. One is to attempt to bring more water on premises, whether it's through household connections or private supplies that are located on premises. But for instance, UNICEF in its programming is adopting what they call basic plus plus, because they consider that it's not practical in the short term, at least, to bring water on premises in rural areas in many countries where UNICEF works. So they say that they can commit to having improved water that's available when needed and free from contamination, basic plus plus, and they program towards that. So I think at the country level, we've discussed a couple of times that there can be national indicators that are complementary, and something that is like basic plus plus could be a national indicator. But I don't think that's something that the JMP would be integrating and calculating for SDG monitoring. Probably the 5 levels are already complicated enough. So with that, let me move on to safely managed sanitation, where Lars has already presented. We have the 5 levels of the service ladder that are similar. We have these pathways into safely managed sanitation. This diagram is a little bit different from drinking water. For drinking water, you had to meet all of the conditions in order to be safely managed. It has to be accessible and available and free from contamination. Whereas for sanitation, it's more of an or relationship. You can have wastewater that's treated offsite, or you can have excreta that's emptied from a pit latrine or a septic tank and taken offsite and treated. Or you can have excreta that is in a pit latrine or septic tank that is not emptied, but is treated and disposed of in situ. So any of those 3 modalities can get you to safely managed sanitation. In all cases, the waste should be not shared, it should be safely contained if there's local storage, and it should be either safely disposed of in situ or transported and treated offsite. So if we look at the country files, there's a lot of data on basic sanitation, on what type of facilities people are using, septic tanks, pit latrines, sewer connections. Also on sharing, there are a lot of household surveys where people report if they share sanitation facilities. There are very few that get at these aspects of containment. Like, is that pit latrine actually safely containing the waste, or is it just leaking it out into the environment? There's actually only one. It was a World Vision survey in 2017 in rural areas. And then there are two surveys that have information from households about emptying practices. That same World Vision study and also the PMA 2018 survey. And the PMA survey also covered emptying in urban settings. But right now, that's a bit of a data gap. It's only one household survey that we have indicating how often or if ever people have had their pit latrine or their septic tank emptied, what has happened to the waste when it has been emptied. Let's move now to the linear regressions again. From household surveys, we have a lot of data about open defecation in Uganda, which seems to be at a very low level and decreasing in rural areas. It was interesting in Martha's presentation, she noted numbers that were higher. So I think it would be interesting to dig in a little bit and see, what are the data sources that suggest higher levels, and maybe there's a story to be told between those data sources and the household surveys here. But for the global approach, it's quite low. But for improved sanitation and basic sanitation, we have a lot of data points and we don't see a very strong progress. If we looked at rural water, we saw a nice slope increasing coverage. We don't see that either for urban or rural sanitation. In fact, it seems like maybe there's a slight decrease in basic sanitation in urban areas. We do find that urban areas often struggle to cope with the population increase due to urbanization. So it can be that the existing sanitation coverage is growing, but proportionally, the number of people having access to different service levels can actually decrease in urban areas because of population growth. Now, the difference between the two lines here, the light line is people using improved sanitation facilities, and the dark line is basic, which remember is shared sanitation, improved and shared sanitation. It's interesting that in rural areas, there's not a very big gap between the two lines, but in urban areas, there's a large gap, which indicates that a lot of people in urban areas who are using improved sanitation are sharing those facilities. And that could be sharing with a small number of households who live near each other, or it could be sharing through like public or community sanitation facilities. Those would both count as a limited service and not a basic service. So really the difference in those two lines between improved and basic, that's the limited sanitation service. And if we look at the slopes of those lines, the rates of progress, they're low. They're much lower than 1 percentage point per year. So again, it would be good to dig into this and see if there are some reasons why sanitation coverage is not increasing more rapidly. In our last report, we have a graphic that compares rates of progress and sanitation coverage. Here we see the coverage on the x-axis and the rate of progress on the y-axis, the rate of change. And we see that Ethiopia has very low coverage and a low rate of progress. Uganda has a higher coverage rate. It looks like around 20, 25%, something like that, basic sanitation, at least basic sanitation. But that rate of progress is low. It's less than 1%. Now, if we would look instead at Malawi, both the coverage is higher and the rate of progress is higher. So we often see this kind of curve where the countries that have either very low coverage or very high coverage have low rates of progress because it's kind of hard to get the engine going a little bit. Whereas when you're at the middle levels, you're kind of steaming along towards universal coverage. And if we look at Cambodia or India or Nepal, we see rates of progress of like 3 percentage points per year, which is really tremendous. And those 3 countries all have coverage of around 80% now, which means that at that rate of progress, they're on track to get to universal, at least basic sanitation by 2030. But yeah, some countries, you see America, Samoa, are actually seeing their coverage rates decrease. So in many countries, progress is just either too slow to reach universal coverage by 2030 or even negative in 25 countries. So the next slide shows that summary table about safely managed sanitation, very similar to the one we looked at earlier for drinking water, where you see the proportion that has improved sanitation. Nationally, it's 38% in Uganda, much higher in urban than in rural. And then that's broken up by the improved sanitation that's sewer connections, very low. Even in urban Uganda, we see very, very low sewer coverage. So the great majority of people are using pit latrines, and there's a smaller proportion of people who use septic tanks. Now, then the next block is about safely managed pathways. So we have those 3 pathways where from the bottom up, we have sewage wastewater that's treated off-site. Obviously, it's very low because there's very low sewage coverage. On-site sanitation that has been emptied and treated. This is your fecal sludge management. Here we have all zeros, partly because very few people report emptying their septic tanks and pit latrines, and partly because there are limited capacity for fecal sludge management in the country, and also partly because there's limited data about fecal sludge management. We'll come to that more. Then we have this safe disposal in situ, which is the main contributor to safely managed sanitation in Uganda. And in coming slides, we'll discuss a little more what that means to be disposed of and safely treated in situ. The next slide just shows progress over time. It's very low progress, and it's all this light color green disposed of in situ. We're not seeing substantial contributions of wastewater treated offsite or fecal sludge being emptied and treated offsite. So let's dig into this safe disposal in situ then, since it's the dominant type of safe management in Uganda. So what does it take to be safely disposed of in situ? Well, this is the case where you have a pit latrine or a septic tank that is improved, that's not shared, and it's never been emptied, and it's effectively containing wastes. So if you have all those things together, we consider that there's a pit, maybe it's a tank or a pit, it's containing the wastes, it's underground, it's not coming out to the surface environment, it's not causing anyone any harm. So that would count as safely managed sanitation. Now, one thing that's not included in this definition is about groundwater contamination. And it's very possible that a pit latrine or a septic tank could be contaminating an aquifer. Maybe that aquifer could be used for drinking water purposes. Maybe that's unsatisfactory or doesn't meet national standards, but that's not part of the SDG indicator. We have that whole other SDG indicator 6.1 on drinking water quality and contamination. So if an aquifer is being contaminated and being used for drinking water, that'll show up in 6.1, but it won't show up in 6.2. Now we have, I mentioned just a few data sets from Uganda about emptying. Let's see if you can, yeah, stay on this one. From that World Vision study in 2017, almost no one in rural areas reported having emptied a pit latrine. There were very low numbers of septic tanks. So this is really pit latrines. And also the PMA study found very low emptying of pit latrines, a little bit more emptying of septic tanks, especially in urban areas. But the great majority of these on-site containers, people say it's never been emptied. It'll be very interesting to see what comes in the DHS, which did also ask these questions. Have you ever emptied your pit latrine? When you last emptied it, what happened? Did the waste get taken offsite? Were they buried locally? Were they discharged unsafely? We'll have a more rich picture once that report is published and those data are analyzed. But yeah, that's the short message, is that if it's never emptied and safely contained, it would count as safely disposed of in situ. Now, contained, what does containment mean? On the next slide, we have some words about what it means to safely contain waste in a pit. We do have a little bit of data from Uganda where there was that World Vision survey that asked if the closest sanitation facility was not full, overflowing, or leaking. That's kind of a measure of containment, and it was very high. So it seems from that one small data source that containment was pretty good in Uganda, but it's not an ideal data source, so it would be good to have more precise information. Where we don't have any data at all, we assume that 50% of septic tanks and 100% of latrines are effectively containing waste. And why is that different? It's because septic tanks receive a lot of liquid along with the excreta. And when you have a lot of water in the system, it's just a lot easier for that water to leak right out and carry contamination into the environment. We know from many countries that a lot of things that are called septic tanks are really a kind of holding tank where the excreta comes in and then a pipe goes out off into an open drain, and it's not really providing effective treatment. That can also happen with pit latrines, but because they're so much drier, it's just harder for the waste to get out into the environment. So that explains our assumptions. But we always prefer to have actual data rather than the assumptions. So where could you get actual data? You could get it from a sanitary inspection. There are checklists to go out to pit latrines and septic tanks and look for leakage, look for the existence of a soak pit or a leach field. I mean, if there's no leach field or soak pit, then there's poor containment, clearly. Or there can be questions asked in household surveys. So the new MIX surveys, this is the multiple indicator cluster surveys supported by UNICEF, have a set of questions about on-site sanitation. So like, does your pit latrine or your septic tank, does it have an outlet pipe for liquid waste? If it does, where does that pipe go? And a separate question about, in the last year, has your septic tank or your pit latrine, have excreta from that ever been released to the surface or the surroundings due to some specific events? And on the next slide, we can see what exactly those questions look like in the surveys. Where does this pipe go? If the pipe goes to a leach field or a soak pit, that's safely contained. If it goes to an open drain, that's not safely contained. It would be lovely to get this type of information in a future survey in Uganda. And then I think the next slide shows that hazardous events, has the pit overflowed? Has it flooded? Has the containment collapsed? Or has there been any other event that has resulted in excreta being released to the surface and surroundings? If any of those are yes, that system should be classified as not contained and not safely managed. Okay, so that's containment, that's on-site treatment and disposal. The next pathway into safely managed is emptying and treatment off-site. So when people do report that that septic tank, that pit latrine was emptied, well, then we want to know what happened. Maybe that waste was buried locally. That can be a very effective and safe local treatment. In some countries, trenching is widespread. As long as it's managed in a way that that excreta is not going to contaminate the surface environment, that kind of treatment would count as safely managed. Or, of course, a more centralized treatment. If we think about fecal sludge treatment plants, we haven't seen any administrative data available in Uganda about FSTPs, either in the SPRs or in other sources. So one question would be, I mean, is there interest in fecal sludge treatment in Uganda? Are there FSTPs that are being built or operating? And if so, is it possible to have some data about how much they receive, what kind of treatment happens at a fecal sludge treatment plant? In other countries, we do have data, administrative data, both about emptying services and treatment. In some countries, there are data about how many trucks there are, how many volumes, how many households have been serviced by trucks emptying things. And in other countries, there are data about fecal sludge treatment plants and how much waste they've managed. But we haven't found that yet in Uganda. And then the third, oh yeah, this is an example of how households can give some information about what happens after emptying. You can see in the first one is just, has it ever been emptied? There's a follow-up question to that. And some of these would be safely managed, like if it's been buried in a covered pit near the house or a covered pit or trench elsewhere, that's safely managed. If it's emptied into an uncovered pit or thrown in the water body, that's unsafe. But then there's this removed off-site. And that's where the household doesn't know what's happened. And we would turn to the sector to say, well, what kind of administrative data do you have about what happens when excreta are emptied and removed off-site? Okay, the last pathway into safely managed on the next slide is about wastewater treatment. Again, in Uganda, there's very low coverage with sewers, only about 1%, I think only about 2%, even in urban areas. But still, it would be nice to build up data systems about wastewater treatment so that as sewage coverage increases, there's a robust data stream so we could look at progress in this over time. And we did see in the sector performance report some data about compliance with BOD and total suspended solids and other parameters. That's great. Actually, for SDG 6.2, we don't want, we don't use data on compliance. We prefer data on the level of treatment that the waste receives. So if it's only primary treatment, we wouldn't count that as safely managed. But if it's secondary treatment or tertiary treatment, that would be enough to count as safely managed sanitation for target 6.2. SDG target 6.3 does look for data on compliance with effluent discharge standards. So this SPR data will be perfect already for building up a time series around SDG 6.3. Okay, then if we come back one more time, a final time, to that summary table on safely managed sanitation, I hope it's more clear now where the bottom parts came from. Wastewater treated, very little, 0. Emptied and treated, 0, which could mean no information, but also reflects that many people have not emptied their pit latrines, their septic tanks. And then this safe disposal of in situ, 18% nationally, a little bit higher in urban than in rural areas. And that's people who've said they've never emptied their pit, their septic tank. It's not shared, and it's also effectively containing wastes. So that sums up then to the total numbers that you see. Okay, that's safely managed sanitation. I know that we don't have too much time left, so I suggest we go quickly through menstrual health and hygiene, and then we should still have time to have a few questions and discussion on that. So for hygiene, Lars presented this very simple hygiene letter. It only has 3 levels, no safely managed hygiene yet. And this data comes exclusively from household surveys. And we know that in a household survey, if you ask people, do you wash your hands like after you use the toilet, or do you have soap and water to do that? There's a bias. People know that they're supposed to do that, so they will say they do it, whether they do or not. So we actually recommend not asking people if they have hand washing facilities, but asking to see them. So can I go visit the place where you family members usually wash their hands? And then the survey team themselves checks, is there water there? Is there soap there? And that we consider to be the most robust method for assessing whether households have hand washing facilities with soap and water. And you can see there's a number of data sets in Uganda. Some of the ones that are not used might be not used because they ask people rather than checking directly. In the DHS 2022, they did ask to go visit the site. So again, we should get a new data point there coming soon. If we look at the time trend then with the linear regression, we see a pretty strong trend in both urban and rural areas. As is common, we see more households in urban areas having access to hand washing facilities than in rural areas. But in both cases, there's a very steady progress and improvement, which is nice to see. Just quickly to speak briefly about menstrual health. This is an area that's not in the SDG framework, but has become increasingly of interest in the sector. And there's an evolving set of indicators that can be used to track menstrual health and hygiene. And many of those questions can be included in household surveys. They often have a module that's asked only of women of reproductive age. So there are indicators around what type of materials women and girls are using, if they have a private place to wash and change. There are other indicators that are also proposed, but they're slowly working their way into survey instruments. So we have one survey already from 2017 where the great majority of women and girls reported that they did have a private place to change, that they did use some kind of materials, a lot of single-use materials in urban, more reusable materials, or about half reusable materials in rural areas. And the DHS 2022, again, will have a more recent data point. It'll be interesting to see. Now, I had a couple concluding thoughts about this session on washing households. The next slide just lists some of the new or potential data sources that could feed into the next update. And the next JMP update on Washington households will come out next year, next summer. And that means that right now we're working to compile and find new national data sources so that in November we can run that country consultation and share the draft estimates with you, get feedback by early 2025 to give us time to write the report in 2025. So there are a number of household surveys and censuses that we've already found on the websites, often the UBOS website, but there are others. There's an Afrobarometer survey. So we know about 5 new data sources since last year's report. We would be interested to know if there are additional ones. And also looking forward, we'd like to know if there are updates to the census. The last census was in 2014. And also the last national panel survey, the last national household survey, the national service delivery survey. These are all from 2020, 2021. So it would be very good to know from UBOS what the plans are for our next round of updates to those different surveys, so that there could be a discussion about possibly adding some of these new questions to fill some of the data gaps that exist currently in Uganda. And then on the administrative data side, the most recent SPR report we found has been 2019. So we're very keen to know if there are more recent administrative data that are available. And there are a variety of different indicators on water quality, sanitation, emptying, fecal sludge treatment, wastewater treatment, that it would be great to get more information on. And I think we've discussed some of the details about which specific indicators would be appropriate for the SDG indicators. Then just another point on when we can use administrative data, when we prefer it. We would like to use it as long as the definitions are aligned with the global indicators and as long as they're representative of populations, total populations or urban and rural populations. And that can be tricky sometimes, especially with private facilities. So when people have their privately owned water supply or their private toilet, if that's captured in administrative data, we can potentially use it. But often administrative data only focus on publicly owned facilities, which are not the only things that people use. We do prefer to use population-based data coming from surveys or censuses for indicators that are about use of, because those are the people that are using the systems. In some countries, there's a desire to classify technologies as inherently safely managed. To say piped water connections, are inherently safely managed drinking water or sewer connections, but actually any technology can potentially be unsafely managed. You can have piped water that's contaminated, that's not available when needed. You can have sewers that don't lead to effective treatment. And conversely, any improved technology, even a non-networked one, could potentially be safely managed. So boreholes or on-site sanitation can count as safely managed. And it's the households that do know what type of facilities they're using. But we do prefer administrative data for those indicators that are more about the quality of service. So for drinking water supplies, that could be, the fecal contamination, the chemical quality, if water supply is available when needed. And from sanitation, there's a whole package of, what happens once the waste leaves the household. If it's emptied, if it's transported by truck, does it reach treatment? Are there fecal sludge treatment plants? Does sewered wastewater reach treatment plants and receive different types of treatment? We would love to draw upon administrative data for those types of questions. So my last slide, then, we shared already. It's just a reminder about the country consultation. We'll be starting the consultation this year in November to publish the report on Washington households next year. And the purpose of the consultation is not to compare the sector statistics against the JMP estimates. And that's because the JMP has to use this consistent methodology, consistent global definitions and terms, which may differ from the national statistics. So rather, our main questions are we missing any data sources? I listed that there are 5 new surveys that we found. Maybe there are additional ones. Maybe there's a more recent SPR. Second, are the data sources used considered reliable? Sometimes surveys are conducted by an NGO, or they might not. There might be a study, a research study, and the NSO could look at that and say, no, that shouldn't count as a national statistic. Please don't use that, and then we don't use it. And then finally, it's always possible that we've made some mistakes in interpreting or classifying the national data sources we have. So we'd ask you to look over those country files, and especially the newly added data sources, to make sure that we've got things right so that we can finalize them in early 2025. Now, I think that's it for now. We do have an exercise, but I believe that's planned for after lunch. And correct me if I'm wrong, Lars, but at this point, let me pass the microphone back over to you.
Thanks a lot. And indeed, the exercise will be for after lunch, but I hope everyone is willing to stay just for a few more minutes for a short round of questions.
Okay, it's 1 exactly, and I thank you very much for keeping the time. And it's already lunchtime, and the coupons are already here. But don't worry, GLAAS has requested that we spend, let's say, 5 minutes for you to throw some questions. It's better to throw out these questions before you go off and forget about them. So just 1, 2, 3 questions. But I noticed that some questions actually from the first round have been answered in the second part of the presentation. So we'll take one from Mr. Wander.
Yes, I'm just trying to wrap my head around certain things. If you look at rural sanitation, we have, well, maybe about 80% of the households having latrines. I'm looking at the disposal methods in the rural areas. In the rural area, after using the latrine, when it's full, they'll leave it and start another. So basically, that's safely managed. Now, it seems the only thing holding us back is the fact that the latrines are not improved. So if I look at the way to go is that we have to get if we get our latrines in the rural areas improved, then we will fly very quickly to safety management. Although again, there is another issue, is what is improved now? That's again where we start, because the definition is quite, I don't know, maybe it is precise, but to me, we interpret it differently, because we say improved is when you have fecal matter is separated hygienically from human. Yes. Now, other people say no, it should be a washable floor. Others say it should have a door and all that. So I'm just looking at my takeaway that most of these rural latrines can very easily go up to safely managed, unless I didn't understand. Thank you.
I think there's a question of contextualizing, which Doreen asked about earlier. Like, when do these things actually speak to the Ugandan context, such that we are not always caught off guard when we get into forums where all these, high-ranking, high-thinking, lofty kind of statistics are presented, and then we start wondering, how does this apply to Uganda? My boss used to ask a question: when do all these things translate into real water for the real person? Or now real toilets for the real person? But I think context, comes in here. Things that are speaking directly to the kind of stuff we work with in Uganda. But that's me talking. We have a colleague from you, boss. Earlier there was a question for her. I think we shall give her time later to explain how things speak to you.
Thank you very much. My concern is on the level of fecal contamination and household drinking water. I'm lucky we don't have like some of the other media houses in, because it will now be flashing on the screen like when you look at 88.9%, some regions it is as bad as 98, 97%. I would like to know maybe two things. One, what was the sample size? What was the sample? Because this is alarming. Secondly, maybe to government, what are the strategies that we put in place? Because in literally, you are right to say that everyone in Uganda eats feces. When you have the 88 drinks feces, when you say 88.9%. Thank you.
Okay, so we'll take one last one from Eddie. Yeah, a short one. Yeah, on the, maybe this is to KCCA or any urban incentive or city. What are the incentives of getting someone connected to the main sewer? Secondly, there was a mention of hand washing, not asking on the methodology of the information on hand washing and the data observed. But when you reflect on the recently concluded census, I'm glad Kusinav is in the house. You have to be intentional right from the word go if you want to use observation and triangulation methods. Because the kind of questions we had, over 100, was it even 100 or 1,000? A set of many questions, and with maybe a average household of 6 people, definitely these enumerators didn't have time to go around and observe. Sure. Okay. Finally, from you, Martha, let's go over it into online. Thank you, Lydia. Thank you, Lars and Rick, online. My confusion came in at the point when we were talking about containment, where we spoke. I think that's like when we flashed it. Where we focused on safely contained and then never empty. And it was speaking to sanitation. I would have been very comfortable to see the word basic somewhere so that we understand fully that what a facility qualifies first to be basic before it graduates to safely managed. For me, it caused a bit of confusion. I don't know about other people. Okay, thank you. Some responses, and we'll finally, the last one will come from Yubos, and then we'll go for lunch.
Sure. Rick, do you want to take the first round of responses?
Yeah, I think I really appreciate what the first respondent noted, that what's holding you back from having a much higher safely managed sanitation is that the latrines are not improved, because most latrines are not emptied. We would like to get more data on safe containment, but if they are safely contained and not emptied and improved, they should count as safely managed. There's also sharing, and there is a fair amount of sharing, so that would not be safely managed. But when it comes to defining what counts as an improved or a latrine or what doesn't, it is technical, but it's also not rocket science. And we do have some resources available, some pictures, some definitions. The key difference is about having a slab that completely covers the pit, that has a small drop hole, and that's constructed from materials that are durable and easy to clean. It could be concrete, but it doesn't have to be concrete. It could be bricks, plastic, stone, whatever durable materials. And we have some resources, and Lars has quite a lot of photos actually about how to distinguish between what should count as improved and what shouldn't count. Things like having a superstructure, a door or a lid, none of that features into the global definitions. Though in many countries that is part of the national definition. So we have to, again, distinguish between a national definition and a global definition. But I completely appreciate the observation that you don't have to have some very highly technical intervention to get to safely managed sanitation. A well-designed pit latrine with a slab should count as safely managed in many cases. I think that was the main one. Oh, I couldn't hear very well, but there was something about the census and how it would be difficult to do observations in a census. I completely agree. You would never expect a census to include observations of hand washing facilities, but in a household survey where the sample size is a lot smaller and you have more time in the household, I think it is practical. So that's what we tend to rely on for that. But it's good to hear that the census has been completed, and hopefully the results will be available soon, and maybe even by next year. I don't know how long it'll take to get the results out, but it'd be great to include them. Maybe Lars, I'll leave it to you to pick up on other ones if there was any. I couldn't quite hear all of the other questions.
There was just a question about basic and safely managed. And basic means it's just if a household is using an improved toilet facility, any technology that is classified as being improved and not shared. And safely managed moves then to also consider what happens with the fecal waste. Is the fecal waste disposed in a safe way, either in situ, just buried and kept safely there, or emptied and treated, or transported to a wastewater treatment plant and treated off-site. But basic doesn't look at that yet. We know it's in the first place an improved technology, but the feces may still come into the environment afterwards when being emptied, transported, and not treated. Great, and I think some of the other examples also about water quality, nice examples for our exercises we do in the afternoon to look at the global indicators and the national indicators. So I think we can just hold off a bit and give more time in the afternoon for discussions about some of those points.
Okay, thank you very much. I'll give 1 minute to Yubos. Just reassure us that Yubos and all these respective methods and frameworks are speaking to each other.
Good afternoon, colleagues. I came in a little bit late. Lillian is my name from Post. I'm a statistician in charge of health. So from Yubos, the question of how do we come up with these questions in the tools that we use, we always have stakeholder engagements. We do consultative meetings And for UDHS particularly, it's an international questionnaire. However, they accept the national input. That's why we always have the consultative meetings and invite various stakeholders to this meeting so that we can harmonize these questions. But every stakeholder always has their own request. That's why you find that sometimes our tools become too widely indicated that because when people are doing self-response, they just respond to how to, maybe do you have a hand washing facility, and the person will tell you yes or no. We are relying more on the self-reporting, which could be a limitation and brings in the question of are they really there in place as they have indicated for us, something that we are trying to look at how best we can go about it. On the issue of sample size of the other issue of sample size that was used for GDHS, we had 20,631 households that were interviewed. And for particularly water, we just did water testing, and this was in collaboration with Ministry of Water and Environment, which undertook that laboratory testing, up to analysis, all the findings concerning the DHS on water, all that came from Ministry of Water and Environment. And they gave us that data and they own the results. Thank you.
So we are in this together. I'm going to allow you to tell us about the incentives for joining the CO.
Yeah, my sister had a concern about the 1% sewerage coverage for urban, but that is an aggregated national figure. But when you come to Kampala, it may range between 10 to 15% national damage, even give you a higher figure. I think globally, especially for low developing countries, sewage coverage, you'll hardly find a city with over 30%, except maybe Southern Africa. Coverage of sewers. Now, especially so for say Kampala, we have a lot of hills, valleys, sewage is supposed to flow by gravity, otherwise it's very expensive. Now, for that reason, Kampala, we have awakened to the fact that we will always have pit latrines, we will have fecal sludge. So our focus is, can we safely contain, and we have standards of pit latrines that are lined, that can be built at household. Can we facilitate the emptying services for the septic tanks? But again, we are also developing rapidly. There are many high-rise buildings that a septic tank cannot serve. So, one, we have to still work towards having more sewer lines to serve such big facilities. But also there are households, as we were told earlier on, who are very close to a sewer line, but they maybe don't want to. They would rather have a septic tank, yet maybe even they cannot soak away what they have. So in Kampala's case, one motivator has been a legal one. We have an ordinance which in which we say if you are within 60 meters from a sewer line, you must connect to the sewer line. So it's enforcing that, and together with Water for People, we are working on national water towards encouraging people to connect to sewers as much as possible. It's very expensive to lay sewers all over, but I think national has shown the motivation to intensify the sewer line. So maybe that's what I can say for Kampala for now.
Great. Thank you all very much for your contribution and active participation. It's a 1:15, and I think that we cannot really hold our lunch any longer. Our coupons are available as you exit, and we've all had our lunch, so we must eat it. It's going to be in the tent outside. Let's be back by 2. I think we can eat very quickly, use 30 minutes to eat, 15 minutes to stretch, and then 2 to be back. Thank you so much. I'm going to be here. I'm going to be here until I want to be here looking after lamps. Yes.
Okay, when do you want to eat? We should bring you, I think. I know we need you again.
I have enough energy reserves.
Oh, that's pretty nice.
But yeah, you can really enjoy your lunch. So I'll make sure that everything, laptops especially, are safe until I'm sure that there's some presents for our Okay, please get your coupon, get your visa to the lunch table.
So be aligning with.
Yeah, they have a list in the.
It's good drinking water. Yeah. In the rural, it's expensive. Yes.
So now
And you could, and that comes from you. There's not everything. A lot. And you find that
You say that when everybody out to start because it's 10 minutes after 2. And would like to make
You need to be
maximum use of time available and then retire early.
On the slides. Oh, yes. How it will work doesn't move anymore.
We're back in session. We're back in session later.
Recognize it at some moments. Okay, that's it.
I hope you enjoyed the meal and that we shall not see negative effects on our eye and our energy level. Members, please come in. We are ready. Everybody come back inside. We are ready to get into the afternoon session. It won't be long. It will be very practical, and it will make us appreciate better JMP framework that we had earlier today. I'm one woman who's easily intimidated by figures, statistics, and things like that. So I even fear to talk about what we're going to do. But I trust that Lars is more friendly with these formulas, Excel sheets, I don't know what, and they don't give him a headache as they give the rest of us. So our colleagues online, are you back? Are they back? I hope that you had lunch, members online, and that you're not starving yourselves wherever you are. We had a wonderful meal here. We hope that you took time off to enjoy our meal for your own health. It's 2:15. Lars, are you ready?
Yes, I am.
Okay, so Lars will give us the instructions for the afternoon.
Okay, thank you very much. Once again. Good, so everyone probably very full after a nice lunch. So let's be a bit more active, and we'll be a bit active by doing a short, and just clicking through, a short exercise. Here we go. Practical exercise, you can do that if you prefer on your own. You can also do it 2, 3 people together. I'd like you, as a very first task, is to find and download the Uganda country file. Yeah, we mentioned that. You can find that on the washdata.org website. Happy to help if you have difficulties in finding it. As a second question, I would like you to identify what data points from the sector performance reports are there shown in the country file, and which ones have been used and which ones didn't. That's the first most important points. Relatively simple but important. I think I'd like you to work a bit with the country file to find what data is there. Then it gets a bit more creative. Just to check on the country file what information is lacking. Yeah, where are there very few information, very little data, and how could this data, the missing data, be included in the sector MIS? How could that come into the sector statistics? And finally, the last question is more to reflect on how much are you currently making use, or are you aware of some of the household surveys that are shown in the country file? Like you'll see there's the health surveys, there's the national service provider survey, and so on. Yeah, just to see, are you aware and are you making use as a sector of data that's collected by UBOS? Do you know that? How is it used? How could it be integrated into the sector performance reviews? For everyone online, feel free to skip until 3 East African time. Or you can also do this exercise individually, or feel free to connect online with your colleagues if anyone is there. But yeah, We'll work on that until about 3 o'clock, and then 3 will get back together as a team. So you can work individually or in groups of 2 or 3, and as a very first task, please download the Uganda country file for wash in households. And I'll be around if you have any difficulties. Please just call me. I'm happy to support. And here, just as a help, that's again washdata.org. There you can find the country file. Aha, already. Good job.
Okay, wait.
So here we go to data. Data household.
Why don't you present that? You go online. Can you project what you're seeing? That should be good.
Then Uganda. So do washdata.org. Now you can download it.
Washdata.org. Were you able to get it? Not yet? Yeah. Go down. Some graphs on the side. Yes, it's gonna go. Here you have the results. But instead of world, I think
Now, you're almost here.
that's it. Now, we can say, download data. We're going to have the choice between data for you is about iniquities. So it's looking at you are in terms of that. One you can, if you want, but it's yeah. You have it. And then what are Lars? Yeah. Question 2. Where do we get the data on the sector performance report?
File, there's one file that summarizes the different data sources used. And there you can probably find whether there is a sector performance review or not.
And look at the latest one that is in the available. Okay, so we are. Estimates for level of that's the results. And then you have start for or B is about the yeah, but the reward, so following the national, following the You're looking at, you just took the SPR. That's it's true, that's not there's another. Look at that. I think that this is a summary that's not after the. That's the detail. That's right. That's what the detail. But don't forget, look at the compare. Now, okay, your civil. Don't put that the. No, that's what I want. So this one. Now, have at the bottom. Now, so the first one is intro. That's the letters. The letters for water. Then you have charts. Then you have part B, basic. Yeah. Then you have all the results, and if it were the ones that are brackets, it's brackets. I look you. I got it. If you look at Yeah. Audience. That's the second. Which one? Ah. I don't know. That's what you were saying. One for mother and one for now. Yes. You're raising a very good question. That's something that we can ask correctly. Yeah. Yeah, that's right. It's a program. Yes. So, yeah. Program performance.
So, the program that has been natural resources, water, yeah, it's big, yeah, the forest. So, that actually even on the yes, now they take other programs. Like, for example, school yes, it's they introduce one. So after for the last 2 years, it's a loss. Yeah. Yeah. So but it's
that's probably that's something we can ask
so what
yeah. So now there is there is yeah, there is. There is one way. There you have the details for all that we're taking now. So you should do. Here you have each survey. It goes, it starts SDR. Yeah, I don't know why you're saying that usually the report has all the information. Yes. If there could be a question for because there is some overlapping that explains why. That's it's for everything. It's for everything. Yeah, it's you might explain when you results national it has both. Oh yeah, you're right. So I don't know. I don't know why. That's a good point. Yeah, because it's adapted for the well, that's a good question. Yeah.
How's it going? Oh, yeah, nice. I saw a good point is to go to the summary.
Now, according to your recipient, the results. They also no, they're yes. Thank you. So that's the difference. That's the difference between our language. No, I know I'm. It's different. So you have. I don't remember. Yeah. Sorry.
And then also. That's why we did that.
Sorry, I don't get it. Thanks for the Okay, let's get back together again. I hope most of you enjoyed spreadsheets full of data. And let's get back together. How did the exercise go? Who completed number 1? That's an easy one. But please remember how to do it. And maybe also show if you have colleagues who are interested in where JMP is getting the data from. Yeah, share the link. Show them where they can find the data. And maybe you don't need all the data. Sometimes you may only want to go to the WASH data platform and prepare some graphs. But sometimes you have questions, you want to go into the detail. And if you have a detailed question, the country profile will likely be able to answer. Number two, so what data was used from the sector performance reviews?
Okay, so that's sector by sector. Okay, not sector, but water, then wastewater sanitation. So under water, we found that they picked data for availability, quality. Then under sanitation, there was data on treatment, wastewater treatment plants. Then data on the improved sanitation facility settings. Then also data on the sewer connections in urban and rural, latrine coverage and identification. Under hygiene, there were no data points. Under wastewater, there was data on BOD, that's biochemical oxygen demand, and then TSS, plus also the proportion of wastewater safely treated, but that one only had data from 2019. Yes, that's where we reached. Which year was that?
Because in the previous years.
2019 had only 3.2. 2019, under wastewater, only had data for the proportion of wastewater safely treated.
Yeah.
Yes, 2019 had, that's why we're saying it had only 3 points in the whole thing.
No, for under wastewater, there was data for all the years, but for one data point, which is the proportion of wastewater safely treated, there was only data from 2019. The rest of the years, there was no data.
Oh, you looked at all the other years.
Yes.
But to simplify, and that was a very comprehensive review of the whole file. For the 2019 report was indeed just for 3 different criteria where data were taken.
Yeah.
So the question was not for you to exactly know how many it was. That's just to make sure you feel comfortable and you will know how to find out which report or what information was taken from the sector performance reviews. And I can see that is very clear now. Number 3, what data are not sufficiently available and where could possibly sector performance or sector statistics help out? Let's give a shot on that one.
So me and my friend here, we noticed that data that wasn't sufficiently available was on menstrual hygiene and also hygiene itself, where we look at hand washing and how could the missing data be included in the center MIS. We proposed 2 interventions. One, since, like, for example, MHM is live between mainly Ministry of Health and Ministry of Education. So we could try to get to their information management system to make sure that we integrate it with the one of water so that we can be able to capture that information. And then also maybe liaise with UBOS to provide us the international data requirements so that when we are picking data from the respective district local governments, we can know that UBOS, which reports to GMP, picks information on menstrual hygiene management and hand washing with soap and all that. I know my other friends this side had extensive answers to that. So yes.
Integration. Yes, in addition, okay, we also had some other things that we thought were not really available, like data on water contamination, availability when needed. Yeah, it's data. Then of the data on the management and public levels, like where you see the clock are there, but there's no data on it. So we believe that when we harmonize indicator definitions and reporting between MOE and MOH, which are the main custodians of this. This could help us in filling the gaps, in addition to what Kate said, and also realigning the sector requirements in UBROS and the international standards.
And once again, I think there was no right or wrong answer. It's just a preparation for the rest of the workshop to identify where there are data gaps and see how they can be filled. What you may have in the sector statistics that would be valuable and could also be used for global reporting. And then the last question. I think again, no right or wrong answer. Like the last question was mainly for everyone here to see what are the data sources that are used, what are the surveys that may include some very valuable data that you may not have heard of before or didn't use it before. Not sure, does anyone want to reflect on that? Did anyone find some interesting data that you didn't use before and think that it's something you should look at in more detail? Anyone wants to share a reflection?
In my opinion, from the discussion and from what we looked at, the UPHS seems to have been a very good source of information. The reporting, what actually happens and what we think is being given out there. Thank you.
Good. Thanks for the reflections. And I hope now we move all very energized into the next relatively short, I hope relatively short presentation.
But I've also noticed that the benefit of statistics also has so many other surveys that take place, and I think some of this data is not utilized at our level where we are having different engagements, planning, because see surveys like National Service Delivery Survey and others which are done by benefit of statistics, and some of those surveys don't really go into like being utilized by all the key sector players.
Yeah, there's a question that my group is answering.
Yes, there's something we noticed and we're just wondering why. When we looked at the data, just like Kate said, there was the data reflected on wastewater treatment. from the sector performance report 2019. But when you look at the actual sector performance report, all those things are improved level, basic sanitation, self managed sanitation are there within the report. So why were they not being used? Was it an issue of confidence?
Like generally, Rick, do you want to, are you with us? Do you want to respond to that one?
Sure. Can you hear me now? I'm on a different headset. Can you hear me well? Yeah. Well, I think the short answer is that the next presentation that you're going to give will compare directly, indicator by indicator, what's available in the SPR and what's in the JMP country file. So I think the answer will be coming through that exercise. But the short answer is that where data in the SPR are nationally representative and comparable in terms of definitions, but also in methods, then we do use them. We find some cases where the definition is nominally the same, but the data seem to not be reflecting the same exact thing. And in those cases, we don't put them in the country file. We don't use them. In some cases, I mentioned earlier that we give preference to population-based data sources for use of indicators, how many people are using something. I think if we think about, for instance, rural water coverage that you have in the SPR, you have an inventory of all of the water sources, protected springs, 200 people per protected springs, boreholes, 300 people per boreholes, and you add those all up to get your coverage figure, as I understand it. But really, those are average numbers, and for maybe one borehole has fewer people or more people, maybe one borehole has salty water and people don't like the taste of it, so fewer people use it. There could be many reasons why the actual use is very different from these standard multipliers. So we give preference to population-based surveys where people are telling us their actual use more than a kind of theoretical coverage figure. But I do think that Lars is going to give very concrete examples comparing side by side for specific indicators that'll make it more clear to understand. So maybe we revisit this question after the slides that Lars will share.
But yeah, so the reason why some of the figures from the sector performance reports are not shown, not even in brackets, is because there's a different methodology, different approach of collecting the data, and there may be some reservations whether they are fully population representative or population based. And therefore, because they would anyway be in brackets, they have not been added in the first place. Kind of. But let's, if you can put up the slides, please. So we took some time and to look at joint monitoring program indicators, but also at the sector indicators. So 42 sector indicators. We were given a nice summary, a very nice guideline of what those indicators are, how they are defined, how they're being calculated. And we tried to put together some of the differences and alignments that we find from our side. What I'm going to present now, it's much less standardized than what we did in the morning, which is really showing step by step how the calculations are done. And that's, I would say, more work in progress. It's kind of our initial thoughts we had when looking at it, when comparing, and we like to give that as an input for the discussions to happen over the next days. Yeah, there's a few question marks in there, we'll see again and again. And it's also possible that we got something wrong at one point. Yeah. Anyway, let me get started. We'll see what we have as an input for the workshop. Sorry. Just to be clear, who is aware of this nice document, the guide to monitoring of WASH sector indicators? Everyone knows that document. Is that correct, more or less? Yes. I take it generally as a yes, and maybe people not from the Ministry of Water and Environment. That's the document we are talking about right now when we refer to the sector indicators. And Marta can share it or also indicate where you can find that if you have any questions there. Good. So, just a quick repetition. Rick already had this slide today in the morning. The administrative data and most of the sector statistics are based on this admin data collected at district level and then aggregated upwards. The database of water sources, the database of the water, wastewater plants and other things. While the survey data, much more from household surveys, or is it which are represented either at rural or national level. I'm not going into more detail here. But when we look at the overlap between the WASH sector and the joint monitoring program indicators, to our best understanding, there's 9 indicators where we have or trying to measure or talking about the same thing. And there is 5 for water and I'm starting again. It's 4, yeah, 1, 2, 5, and 10, while 5 has a 5A and a 5B. And there is another 5 for sanitation and hygiene. While one of that wasn't in the document, I'm not exactly sure why, that the wastewater, proportion of wastewater safely treated, I couldn't find that nice guideline, but was used in the reporting, and there's also an overlap there. But let's talk first about rural and urban water supply. And Rick about the country estimates by the joint monitoring program, which heavily rely on data from household surveys, especially when it comes to coverage. Yeah? All the data for what people use in urban and rural areas comes from household surveys, people being asked what do you use, and complemented at least for quality and partly availability with administrative data. The sector statistics work very differently. I mean, it's the same definitions, the same goal, but it's based on the infrastructure coverage. There's the water supply database, the utility performance management information system, and the data and some data from the National Water and Sewage Corporation. So basically looking on how many boreholes are out there, how many protected wells, and then there is a modifier or multiplier used. So for a shallow, for a deep borehole, for instance, there's assumption that 300 people are using one protected springs would cover 200. So you have a database with all the infrastructure, and then it's just multiplied by the number of people using it. So at the end, we don't expect both data sets to be exactly the same, and that's also okay. But we would understand why there are differences in the two. And that's just to know that it's a different approach of how to estimate or how to check on coverage. So going a bit into details on basic water. That's mostly aligned between the two, between the sector statistics and the joint monitoring program. Maybe when it comes to the definition of the improved sources, the joint monitoring program would also look at bottled water and delivered water as improved. They are not specifically mentioned here, but I think that's a minor difference. For the calculation, the limited or whether the source is within 30 minutes is not that specifically mentioned, but we assume that that's integrated in the multiplier. That if a multiplier of 200 is assumed, that that's 200 people using this borehole and don't spend more than 30 minutes round trip to collect the water. I assume that's the case where the 30 minutes round trip are integrated into the sector statistics. For the data source, the aggregation for sector statistics, it's an aggregation from this databases, while joint monitoring program is on the surveys and censuses. Possibly, we would argue, but maybe good to put the question mark here, are the surveys more accurate in terms of what people are using? While the sector statistics have certain advantages that's available at the district level, or it's very granular and could be used in different ways, while the estimates for from the joint monitoring program are only for urban and rural at a relatively high level. I'm jumping around. I reorganized the indicators a little bit for convenience. So for building up for safely managed drinking water, let's look at water quality or indicator gain first. That also seems to be the same. It's a line between joint monitoring program and the sector statistics, more or less. Here, for the sector statistics, basically it says it should be compliant with water quality standards, very broadly. But in reality, when looking into the report, it in fact just looks at present absence of E. coli as an indicator bacteria for fecal contamination. Sources, it's own reporting from the National Water and Sewage Corporation. It's from the utility MIS for small towns, and from the Directorate of Water Resources, the Water Quality Department for rural. From the joint monitoring program, at the moment, this data, and that's what we also found in the exercise before, that's the information that they're being used. Urban, almost 100% safe water. Rural, in 2019, the estimate or the number used was 59%. Now there was this water quality survey, and it was the UBOS-led DHS that included the water quality testing, and I think once that's out, it will be an interesting question on whether or not to integrate that into the estimate. So even to replace sector performance review data with the household survey, or like to understand if there are differences, if they are, why they are coming from, where are they coming from. And I think the obvious explanation what we could expect is for urban. The last report I have seen from 2019, almost 100% of safe water in urban areas. And that's well possible that when the National Water and Sewage Corporation does their water quality testing, they go when there is water, and they will check possibly at the point where water is delivered into the house, at the water meter. And they say, we delivered safe water. All our water that reached the household was safe. While UBOS tested the water at the point of collection. So a house may have a water storage tank, and that goes then through different ways within the compound. And at the point the household collects the water, it may be contaminated. So if the UBOS data show, oh, it's not 100%, doesn't necessarily mean that the UBOS data are wrong. But it also doesn't mean that the National Water and Sewage Corporation reported wrong numbers before. I think it suggests for the sector to reflect and understand where those differences are coming from. good to ask some critical questions, but really the data can be trusted on both ends, but likely there's an explanation for it. Yeah, but basically, just the definitions align. And that's then used as an input for the safely managed water calculation. On functionality or availability, there is a bit of a slight difference. It mostly aligns. At the sector statistics, it's the percentage of days with water in piped systems. That's, I think, easy to be translated into availability in the joint monitoring program monitoring. The percentage of functional water sources may be a bit less. Yeah, it's more on the availability of water, less on the functionality. Like from a household perspective, is water available generally? And if a water point didn't work for 1 year, it's no longer the main water source and wouldn't be reflected as the main water source in a household survey. So functionality, to some extent, yes, it can be used, but it aligns slightly less well. So for the sector statistics, our understanding is that functionality and availability of water distribution networks is used just as a modifier to the broader calculation of basic access to drinking water. And for the joint monitoring program, it can be administrative data, it can also be household surveys. And here we just put the standard question that's often used in surveys in the last months. Has there been any time when your household did not have sufficient quantities of drinking water when needed? Now that's a new kind of core question that's integrated more and more often in household surveys to give kind of a reflection from household perspective, whether or not water supply is reliable. Again, this one is also just used as a modifier to calculate safely managed water. And that's now here, just a summary. So safely managed water, we again say it's aligned, like both calculations for the joint monitoring program and sector statistics are based on accessibility, availability, and quality. On accessibility, what is used for sector statistics is an aggregation from the database and just looks at just looks at piped water. And that's I'm getting confused. I don't have the newest version of the slides up here. Apologies for that. But there hadn't been major changes anyway. So one difference is in the calculation that is used for sector statistics, only yard connection and household connections, and that count for accessible on premises. While for the joint monitoring program, any improved water source at accessible on premises would count as at zero collection time. That can be, for instance, self-supply. Like if a house has a dug well outside and uses this dug well on the compound, they are on premises and it's well protected. That's an improved water source on premises for joint monitoring program that would fulfill the criteria of accessibility.
A quick one. We have had a serious debate about. We have had a serious debate on the supply based on rainwater harvesting tanks and protected springs in a climate change era. How do we model this for sustainability? Because that's one question that always comes up. What happens to such a self-supply like rainwater tank in dry season? Because we actually know that we should spend 3-4 months without enough water and we need to be enough to run all household the requirements somewhere there. How do we manage that?
It's a pretty detailed question. and more on, and from a monitoring perspective, just to say what access is of a household. If a household in a household survey, says my main water source is rainwater. The rainwater harvesting tank is on premises, and then it also fills the two other criteria. The quality is good, and the household says it's available whenever I need it. We would say that's safely managed. Whether or not it's a good strategy to get universal access to safely managed, I think that's the question you are asking, and I think it's beyond what I can answer just while standing here. But if there is an area in Uganda where people can have safe water on premises all the time when they need it, it could count as safely managed. And I think there's no reason to exclude them just because of knowing that there may be in some areas some concerns around it. It may just not be the right strategy to push for those technologies. Let me briefly run through the few slides. So on availability, we have the data sources indicator 5, for quality indicator 10 for sector statistics, and they're used as a modifier. Like if quality is 50% and availability is 50%, and accessibility would be 100%, it's just 100 times 50% times 50%, ending up in 25%. Yeah, that's how the logic is and the calculation in the sector statistics. In the country estimate for the joint monitoring program, however, it's just the minimum score that is used, so the lowest of the safely managed drinking water criteria, accessibility, availability, or quality. So if you have 100% accessibility, 50% availability, 50% quality, it would be capped at 50%. As per the current methodology. So there's a small difference how availability and quality are factored in. Sector statistics as a modifier in the joint monitoring program just as the minimum criteria. And there's a small difference, there's a more significant difference in accessibility, how they are established. Yeah, one from the database aggregating up, the other one based on household surveys. But the definition as such aligns pretty well, like using the same terms for the same thing. A few more slides now about sanitation. Here, a main difference is again very similar. For the sector statistic, the data source is are environmental health data, environmental health data collection forms, which are, to our understanding, sent annually to the district government, and they complete the information and then send it back, and it's aggregated to come up with a national estimate. Here, key question, and you'll see that over the next few slides from our side, is how does the district local government and these urban councils, how do they get data they need to complete the forms? Like, how do they know what the level of open-ification is within their districts? And that's not included in the guideline, so we don't really know where the raw data were coming from. And there is some questions, and we'll get there on the safely managed, about emptied and treated. And we'll see that under safely managed, there's more focus on whether it has been emptied, but less on whether it actually went to treatment. So, let's start with open-ification again to easily go from the lowest service level upwards. That basically aligns the definition, just what I just explained. Our segregation is very different. It comes from this district level reporting for the sector statistics, and it comes from from population-based surveys for the joint monitoring program. And I think a question that emerged today, and I find very interesting, is to see why the joint monitoring estimate is, I think, around 5% open, while the sector statistics show 20%. Yeah, there must be something to unpack and to understand what of the two seems to be more reliable. Why is this difference, and how would that be addressed? Because I assume it's confusing to any politician or anyone involved if do I have now 5% or 20% open, as it's really a serious problem, or can something more or less under control? Still need some action, but we are almost there. For basic sanitation, yeah, that's well aligned. Again, it's just the data source that is different, but otherwise, I think not much more to add. I mean, I had the discussion point about improved, unimproved, but also there, what I read, it seems to be the same text. Then the specifics of observation on the ground, I think that's something always can use a bit more alignment to make sure people classify the same facility the same way. But now coming to safely managed, there's a few points here. Basically, it aligns, definition aligns. What is written? One question put here is about limited sanitation services, which actually already goes on to the basic services, or that's one of the changes I made, and it didn't make it through to today's presentation. Yeah, is it shared or not shared? That is not very clear where that comes in the sector report. But for safely managed, more importantly, is the treatment that is not stressed that clearly. It's kind of, how many households are connected to a sewer system? And how many pits are emptied by a service provider, but not really what happens afterwards. And that's, I think, something that needs to be discussed, because that makes a difference, and with more and more pits and septic tanks probably being emptied in the future, that will be an important point and could then show very different numbers in the future. For the proportion of wastewater safely treated, all I can say with very little information about how it's done, just looking at the latest sector performance reports, there seem to be more or less aligned. However, for the calculations here, it's the compliance with the effluent discharge parameters, while for the joint monitoring program, it's mainly looking at that it provides secondary or high levels of treatment, classification of the technology used. Here at the moment, the data from the sector performance review are being used. Good, almost there. Going to the hand washing facilities. That seems to align, except for ashes. Like, I think it still states that ash is acceptable as a hand washing agent under the SDGs that was removed. So it's really just soap and water. The joint monitoring program doesn't talk about clean water. Yeah, it just talks about water available and soap available, while the sector performance statistics currently say it has to be clean water and either soap and ash. So there is a small difference between the two that could be discussed. And then finally, we have hand washing in school or in schools. That seems to be well aligned. Generally, the percentage, I mean, the sector statistics look at the percentage of pupils, while the GMP looks at the percentage of schools. But I guess I could go either way, just good to be aware of that difference, and just to be aware that there's also many more indicators, or a few more indicators that we'll talk about that on Thursday morning about washing schools and healthcare facilities, including drinking water, sanitation, and hand washing, and environmental health and disposal for healthcare facilities. So there's more information there, while the sector statistics at the moment just have one of many indicators that will be available or currently available in the joint monitoring program reports. So let me get up the right slides with the right questions, and then we'll get started with a small discussion round. But maybe first, if there's any questions, or even more than questions, reflection and corrections to everyone, like to explain, maybe getting some specification. I see someone is already updating. Any additions?
Thank you. I don't think it's additions, but it's like menstrual hygiene, and these slides did not come out clearly. But also when we look at the, you said that there is a focus on gender, and in the morning presentation, you showed us a chart where it was showing us burden of what on women and children, and the contribution of men, or the share of men on that burden. So I was wondering, where is that source of data, the data type that brought down that kind of chart, the burden of women? But when we look at our sector performance indicators, we also have gender emphasizing the role of women in key positions. So gender here is not coming out clear.
Mine is a wild one that may not necessarily relate to what you've been presenting, but what came to mind when I saw the EHD collection forms, I was reminded of the local government assessment exercise that happens every with the joint monitoring program in line with the local government assessment, because all this that we have presented, the ultimate provided the information at the district local government. So that's what came to mind. What is the linkage? If we are to change at this level, how will it? Because what I know is they are updating that assessment, the assessment indicators, because they were originally based on a sector approach, if my mind serves me right, to the program approach.
At the beginning, for the sanitation, there was the question, where do district local government get the data on open defecation? And yes, of course, looking at, like, for example, Martha's presentation this morning, open defecation is defined as 100% minus coverage. That's where we're getting our OD. If you look at the program performance report for last year, 2023, it is the same story. So actually, I think we also need to think again, because if we are talking about coverage and then we say 80% of the households have latrines. Now, definitely you're saying that 20% are practicing open defecation. And as you pointed out, we have with shared, we are not very clear about shared. Of course, this 20% are sharing, they are into the sharing, and we may need to have a better way of calculating our open distribution, because I don't think really 20% of our communities are open distribution, at least not in the village.
Yeah, but
so, so yeah, I just wanted to say it.
Thank you so much. We want to start with the regret. I regret that there is a question I partly wanted to ask, but whatever we are deliberating is also pinning at that question. If a district water officer X provided water access figure of a district, what is the composition of that figure? It's not an assumption. Does this district water officer embed piped water supply, which is piped water supply, which is large towns, even water supply, which is rural, in that figure?
There was a Medina from Ministry of Health, sorry, I'm coming late. I just want to highlight that we have underutilization of data that is reported within the health sector in this discussion. So within the health sector, we have village health teams. Village health teams at village level, a minimum of 2 per village. So we have about 150,000, and they submit quarterly reports on several environmental health elements, including open education and these different facilities. But these reports don't have any, at least for the discussion so far. And these volunteers enter this data every day. And the ministry has gone on to digitize these works. So far, for at least coming to 40,000 VHTs, they report real time that for about 600,000 households on these different elements. And so it will be good to include some of this. Thank you.
Yeah. Thank you. I go back to the, still it's about harmonizing data sources and the kind of data that we collect. Now this goes to, normally when we are declaring open defecation free villages and the ministry people are present, even when everyone has a latrine in a village, but then we don't consider the criteria of a latrine, we actually hunt for feces. True, false. We actually hunt for it and even look for it, even when it's hidden in the bush, right? Then, when we find a latrine facility that is heavily infected with flies, we still it contributes to open defecation because it's creating a linkage between human feces and the human being, right? So, with that background, how confident are we to say that maybe that happens to us on the CSOs? Well, because we don't declare open defecation free villages without government approving. Government has to come and tell us, okay, now, okay, you contributed. Maybe for government, it's just number of toilets minus, you see that nothing for OD to determine what's OD. Because this is now confusing me. Because if we say that even just having a heavily infested latrine is open defecation, and even then look for feces safely hidden in the bush, and they call it open defecation. What is the true definition of open defecation?
In the same way, that question of open defecation, why do we somehow agree to that? You had because coverage is counted against a household. Now, if a household has 5 people, what's the likelihood that they all go and share with the neighbor where there is chance for bush? So there's a likelihood of open field. It was an assumption. I think that's the background why we go for that. It's easier. The household head might go to the neighbor, but what about the children? And there's a risk where there is not really enough numbers to still find OD in the compound or some elevation setting. Even schools outside, it's there too. I want to ask Dr. what just submitted. I have this surviving workers as a statistician. And 106B, what you're talking about on community health, has a reporting level of below 13%. I don't know if it has changed now, but how reliable is that information to be exploited for the whole country in the last 5 years? Because that would be a basis for, yes, I know it's an opportunity that we need to jump on, but how reliable is that information? Because 106B is the worst field, competence and the timeliness has a lot of questions that have been bringing a lot of questions on the reliability.
Thank you. I want to share experience how we are doing this commemoration sanitation, specifically on open education in our program focus areas of Kawarere and Nyangao, and probably the experts in the room can help us understand whether we are doing it better or how we're supposed to be doing it from what I'm hearing. If I had it clear, I think that open education is the coverage minus what? 100% minus coverage. When we visit our community, the eliminators do observation at the household level. If they see feces around, if as long as it's not fresh, the assumption meaning if it is fresh, probably it's some kid who has pooped there and was not intended, but shortly after the big cleaning. But if it has stayed for some time, by mere observation, you know that household is practicing open education. And I think one of the experts said that in computation, that if, let's say, in that community, there are 100 households, and 89%, if we fall below 89%, then you're practicing open education. But above 89% and above, then that community, in that village, is not practicing open education. I put it out there as experts in the sector, in this room, but help us understand whether we are doing it right or not. I'm told that 89% is by standard as it comes from the news located. Thank you. Mine are two. One is about in Uganda, when it comes to school wash, we are implementing the UNICEF guided wash in schools policy, measuring educators as guided by that policy. I wonder how it connects with the GMP. Is that also considered when it comes to school wash? Then secondly, is about open defecation. Again, for say urban centers and well, for urban centers, one, you may have a toilet in your home, but urban centers are places of great movement. For instance, Kampala, during nighttime, we have maybe 1.5 million people, but during the day, it's about 4 million people who leave their homes without toilets. So is the element, say, of provision of public sanitary facilities factored in when you are looking at open defecation?
Right, thanks a lot for the reflections. There's not really many questions, like one question about the school wash, and we'll have Thursday morning dedicated to school wash and wash in healthcare facilities, where we go into more detail how the joint monitoring program is coming up with the country estimates. So that will be on Thursday morning. About optification, just to clarify from joint monitoring program side, how that's done, it's coming from household surveys. Yeah, it's question to households, what are you usually, like what are members of your family usually practicing when you need to go to the toilet? Now I didn't say the right question, but the specific question. What facility do you use? I need to check the question again, how exactly it's formulated. But it's a specific question on what you do if you need to go to the toilet. And openification is one of the possible answers. And if people self-declare to practice openification, it would show up as openification. How it's done in Uganda for the sector performance reports, and I think I'm very curious to learn about these village health teams and to what extent those data make their way into the district level reports. Like is this the raw data that are then used by the districts to report? I think it would be nice to reflect and understand if that's the case, if there are people collecting numbers on openification, that's also being used. I'm also looking forward to learn more about this shift from the sector approach towards the program approach and how that may have impacted the indicators and when and how the sector here plans to possibly make some adjustments. But I think now from my side, coming out to the fund side, to be here to support, to listen in, to further explain what the joint monitoring program is doing. But as a next step, I'd like you to do a group work in 5 groups, and that's kind of thought as a starting point for the discussions that maybe on day 4 will happen. Is there any changes that need to be made? What are kind of the key issues? So if we can have one group on the side over there on urban water, and then another group a bit here on rural water. Okay, a group here on rural water. A group on urban sanitation. Where do we have urban sanitation? Urban sanitation here. Rural sanitation. Where do we have rural sanitation? Yeah, but we have to split it a little bit. Okay. Rural sanitation. Let's do rural sanitation here and hand washing there. So if you have a specific interest, please go to one of the groups. If you don't have a specific interest, maybe go to a group where there are not too many people. And I'd like you to have a look at the estimates, the WASH sector estimates, and compare them to the joint monitoring program estimates, just to see are there major differences. Because if there's a big difference, there's probably also some underlying interesting questions to be asked. As a second point, I'd like you to reflect which is likely to be more accurate. And that can also be for like whether it's survey data or administrative data, like what is more accurate. As a third point, I'd like you to think about duplicates. Are there data collected by 3 different actors? And they're even different or the same, like are there duplication of efforts? And as a last point, are there any data currently generated under the wash, in the wash sector indicators, the 42 or maybe just the 9 we looked at, that they're not being used for decision making. Also be critical and think through again, are there some data that's just not possible to collect in a way that it's useful to make decisions, which may be an indication that maybe not that important, possibly be dropped. So for the next maybe half an hour or so, I'd like you to just sit together in a small group, start a discussion, but it's not the end of the discussion. And at the end, just to have 3 bullet points, 3 quick feedbacks for the group of what you think needs to be discussed this week here in Xinjiang. Does it make sense? So we have urban water, rural water, urban sanitation, rural sanitation, and over there, hygiene. So if you could go into the groups, use those questions as a guidance, but the outcome should be 3 key statements of what you think really needs discussion for the sector over the next 3 days, 3-4 days. Thank you.
As we go into our floor, team commission is available, so please switch your bits, get a cup of coffee and let it fuel the discussion.
Take your tea.
That's it. After the
Sanitation.
It's in here. But then
How will I like? Are you a bit cheap? Yeah, we have them here. This one was but so basic water is 2020 plus maybe
This shows.
So, but where you just manage. Number one. So I didn't want so limited. Then here for us, this was not very. I just said not measure. Not measure. But sorry, we can put the one and the say what. So you are saying you must be hard. Yeah, that's it. But for them, they were right, they were what you don't have them in terms of the different things and but in terms of the say there's a estimates alignment. The estimates no alignment.
So unless we are saying that for that one, we must use the amount. So the assumptions related to the so we are sure that the assumption is so if you what does it which assists to real but if also it is vacation, the population, the Now I'm bringing someone technology type. What else do you say? We're discussing the I don't have also one of the time. So this one around so that we are meaning we are bringing in the one. So we are done now. Yeah, what makes related to the service. What makes JMP estimates not yeah, to identify one and then but the JMP go there.
That's information. As much as possible.
We are looking at the same kind of data that are locally related because we are most of these finance. What is the spread of bringing some So do I add this? What happens? I look for this like right? So what do you want to write?
Clearly, we're having a good time. And I hate to interrupt the flow of knowledge, but I have to. Because we're trying to remain within the time that we stipulated for the day. We will have to cut this interesting exercise short. So shall we please get those 3 most important points of reflection so that we share them and we start winding down for the day. This is a very interesting exercise. Let's first reflect on the 3 points and then you get back afterwards. But I'm sorry, you really have to cause it to stop. You can't apologize enough. Okay, members, let's have our reflection. Okay, so where it starts, I like rural water, and maybe the rural water team can start. The 3 important points, important considerations or realizations that have come from your exercise, and let's hear them. We have only 15 minutes. Rural water. I was looking at the wrong group. I'm sorry. You're not rural. That you leader. Get it? You know, it's 800 devices.
Good evening. My group members, who wrote the group members, can you put up your hands? Oh, what I'm going to present. Yeah, we looked at, I wish we could put the guiding questions.
You still have them, yes. The guiding questions, please.
But then, as you present, it was basically on the alignment of sector estimates. We refer to this year, or the reference year was 2020, because that's the data we have under JMP. And also we went and looked at the sector performance report of 2020. And that time we realized we were still reporting under SPR, not the program reporting. We realized that under the service levels, that's the safely managed water, what is it? A moment. Yeah, the safely managed water sources that considers accessibility, quality, reliability, and availability. We realized that in 2020, we didn't have data on that. But according to the JPM, the figure was 8%. Yeah, safety managed 2020 was 8%. Then when we went to the basic level of service, in 2020, JMP was at 41, and for sector performance report of 2020 was at 67. We don't measure limited and improved in the sector performance report, and also no service. However, according to the JMP, limited was at 3, and improved was at 14, and no service was at 6%. And when we looked at the indicators, sector, whether they are accurate, the emphasis was mainly on our side, the sector performance indicators. We said that in regard to the safely managed water supply, we are far from being accurate because of the following. One, that is the technology type and many technological options we have. For example, we consider that a borehole serves 300 people, but this was on the basis of the borehole type. Engineer, Mark 2. Yeah, it was on that, those are the days they were considering that the Mark 2 had a yield, some technical issue. Someone come. What is the engineer Godfrey?
It's okay, you can focus on the main reflection.
It says that study that brought up the 300 personnel was dependent on that specific type of the installed farm.
So in other words, the 300 is dependent on the type of the farm for the borehole. But also we looked at the population density. You find where it is sparsely populated, the 300 may not suffice. You find that there is a water facility serving maybe even 10 households, considering also the settlement patterns. When we looked at equity, that is sharing, or maybe if we consider source per village, you find that we give just facilities not based on the number, but just because we want to improve on the equity, inclusion, normally contribute. This is also related to the functionality of O&M, poverty, affordability, acceptability, and service level and technology. Then the sector indicators that are currently not used. We have quite a number, we have indicators, but the major ones that JMP is just mentioning in passing is gender. We measure the women that are holding key positions, management, the water sanitation committees, because we are talking about rural water sanitation committees, that is the community-based maintenance system. But also when we look at the functionality usually we are considering the number of days that a community can go without water, but for us, we are looking at functionality at the time of spot check. Then when you look at the source per village, completely are not appearing in the JMP, but this is to bring out the equity and the presidential directive. And also another one is per capital investment cost, which is mentioned and not used under JPM. They are many, but this one will try to be focused majorly on rural. Thank you.
Thank you. Those are interesting reflections. I think you can quickly move to hand washing and hygiene and hand washing. Somebody make our 3 important reflections. What's the team?
Thank you very much. There isn't a lot of data when it comes to hygiene. Even I think during the presentation, we will see that there weren't many indicators under that. When we are looking at it, when you look at the JMP data from 2012 up to 2022, you see there has been some steady growth from 17.2% to 30.9%, but there has been like an increase of 1 or 2%. So that is number one, an increase over that period of time. The increase is not much, but yes, there is sure an increase by maybe 1% or 2%. Number two, we try to look at the data that we have in different, when you look at JMP, then you look at when the Minister of Water was still reporting through the sector performance report, you find JMP gives 13.1%, then SPR gives 8%. So I think that is an issue of who was the ministry. The reason we have seen is that the Ministry of Water was not breaking it down to the different categories. So either way they could not be right, because one was looking at basic, but I think the Ministry of Water was looking at both basic and limited combined. We also again looked at the other thing is there are different sources of data available for hand washing. We looked at the performance monitoring and accountability, usually done by Macquarie School of Public Health, and then the National Panel Survey done by UBOS. There are significant differences in the two. That's basically what we have looked at. Thank you.
Great, thank you very much. Was wonderful.
Yeah, there was a group here, rural sanitation. As concerns the first question about alignment, we found that all the indicators were really not aligned. We looked at the latest, we wanted to compare like to like. So we have 2023 data, but JMP didn't have it. So we went to 2022. And for 2022, for example, for basic sanitation, JMP, looking at rural, for example, JMP put it at 2. Whereas the program performance report put it at 24. That's a very big difference. Looking at self-managed sanitation, JMP had it at 16%, while the program performance report had it at 9%. Openification, JMP had it at 5%, while the program performance report had it at 23%. Those are widely differing the figures. So it means we have a lot of issues here. Actually, for limited, the program performance doesn't show it, and unimproved, they don't deal with that. or whereas the JMP gives that. So we looked at problems, our problems lie in the fact that we have maybe different data sources, because we looked at the JMP basically using surveys, while the program performance relies on data that is collected from the district local government, who get it right down from the village health team members. Also, maybe to note also, we may need to discuss this as we move along. There is a lot of attempts to improve this data through, there's what they call the ECHIS, the Electronic Community Health Information System. And then there is the WASH MIS that is being developed also by the Ministry of Health. So it's actually developed, but getting it operationalized. Yeah. Then we also looked at the issue of definitions. We have a lot of problems with definitions amongst ourselves and amongst the JMP. So, like for example, OD, how we calculate OD, you can see if someone gets 23% and another gets 5%, because we have issues there. What we call share is also another issue. There are cultures where share is normal, and we don't know whether it is one household or because they stay together in one compound. Then there is basic versus safely managed sanitation. Maybe the solution would be to call it at least basic, but we still want to go to safely managed because that's where the SDG is supposed to lead us. Then how we calculate all this data is an issue. That is related to the definitions. How we calculate this data is an issue. I think that's where we stopped. Thank you.
Building more sanitation, urban water.
Thank you. On our side, we looked at some key one. We have a lot of close in the distribution. Many of them, the biggest challenge we have is the means of verification. How will we verify this data? And that's why we have different resources and we shall definitely come up with different answers. We measure and we have different answers. Because we have looked at our transit the populations, and we are now in fact look at which data will be captured, and it's important. Data on public toilets, the allocation and the usage. How we capture it? Data on wastewater management. We saw it had a lot of gaps. We have the connections, a kilometer, or we have a pipeline of sewage lane. So we need to look into that, the number of the connections. Then we looked at data which is captured at waste treatment plants. Some plants, like in umbrellas, capture discharge volumes, but because we don't have it in the SPR and we don't capture it, and I think it's an opportunity to put an indicator in the SPR and also treatment efficiencies. We have data which is self-reported by the utility, which we need to put more use to improve on our reporting across the service chain. Those are the major things that we looked at, Thank you.
Is there a group that hasn't presented?
Okay.
It's integrated.
Okay. It was still bad. Urban water, the baby was not delivered. It's okay, still baths happen all the time. And we mourn, but we move on.
I think in future, having urban water, we will cover it. We need to bring utilities improve the Ministry of Water will come from urban department, but we do development, we don't do operations. So we don't have a person from umbrella, national water. They operate most all the regulators. The regulators are coming in maybe tomorrow if there was a meeting, but at least the operators of urban water need to be invited because they do to their interfaces with their service, with their customers.
Lessons learned. Yes, we have a hand.
Just wanted to verify something for each Since my supervisor has come in and to verify something, it's not true that the reporting rate for the village health team is 13. Actually, the lowest we have had in the last 8 quarters is 72%. But I know we'll have an in-depth discussion. I just wanted to go with that in your brain. Thank you.
Thank you for speaking up for the village health teams, so that we do not have any misconception about the things that they do for us. Okay, we're going to wind up because it's 5 o'clock now. Our time is fast spent. Lars, would you like to say something about the reflections? Are these things that you were thinking about yourself, or things that you realized as you prepared for this presentation, or are they somewhere?
Right, not too much to say today. I think we heard many of the points we realized also when we went through the documents where there are some gaps or possibly misalignments. And I hope as it's a workshop to align between all the different actors here in the room, including the joint monitoring program and the global monitoring, looking forward for the next 3 days. That's all.
Okay, thank you. I think that by reflecting on all these differences, contradictions, points of convergence, we are slowly getting to address some of the objectives of the workshop. You know, when we reflect deeply like this, it demonstrates that we are now understanding better, yeah? And we are seeing points that need to be addressed and harmonized as we go forward. So this is a fruitful exercise as it is already. As we wind up, I wonder if anybody has any special reflection they want to. Okay, I'm going to request the members that reported. I know some of you were reporting off your notebooks, others from your computer. Kindly share those notes, those raw notes, to help us compile a comprehensive report of these reflections, because ultimately they're the ones that will lead us to the position that we want to reach, harmonized understanding. So can you mail it? I'll be happy to. I'll have to receive that. Okay, let's wind up today. Who wants to have the very last word about today? How you feel about today? The very last words. Some of you were happy, some were energetic, some were journalistic, some were hopeful. Let's have just one person to give us that one overall reflection of the day, and then we shall plan for tomorrow. There are some voices I haven't heard all day, but I'm sure it's because they have been listening intensely and taking it in. So I'm going to volunteer. So that overall reflection, how do you feel now that the day is ending? But before you give that up at us, I'd also like to appreciate our online participants. We had a whole 52 of them. So thank you very much, online team, for the chats, for the contributions, and for just being there. We really appreciate, and we're looking forward to further engagement tomorrow. Please join in again and spend some time with us. Okay. The last one, the opportunity to give us a memorable end of day one. Thank you. Well, we came in here today trying to reflect
upon our national indicators, alongside the GMP reporting standards. And I must say, we've been able to identify the key gaps, the key issues we need to go back and reflect on and be able to find ways of covering up these gaps so that we're able to have better data that can help us plan better as the sector. So for the evening until tomorrow, let us go back and reflect upon the different gaps that have been identified. So that tomorrow as we come in, we're able to have a fresh mind and tackle this jungle with a better mind. Thank you very much.
Thank you, members, and I want to wish you a very nice evening. Please let's get time tomorrow, and we'll take it up from there. We'll go into more discussions of this nature, and we'll truly be enriched by the time we finish this workshop. Thank you, Martha, for organizing. Thank you, Team Logistics. Thank you to the hotel. Thank you, everybody. Have a very wonderful evening.